Dr. Flanagan?
Yes.
Hi, this is Dana. We will be starting in about 3 or 4 minutes. You just want to hang on.
Okay, sounds good.
Okay, thank you.
You're welcome.
Could you wipe this down again real quick? Could you protect and serve a little bit more?
I did my duty, but she didn't wipe.
You just did such a great job of it. I figured we could just station you.
The second time I sit around. I never touched it.
Our guy.
All right, put that with let's do this one.
everybody. Thank you for joining our 423-20 work session. The goal and theme of this is returning to service plan for opening Chandler. I've got some opening remarks, and then we will turn it to city manager. Actually, we'll invite our health Dr. Flanagan to come, and we will proceed from there. I do want to start off this work session by saying on behalf of our council, our thoughts and prayers are with those who have been affected by COVID-19. This affects our businesses and workers, as well as those who have had their or their family's health affected as well. I do want to thank my fellow council members, our city manager and city staff for working tirelessly to protect, to advocate, and to serve on our community. These have certainly been trying times for everyone, and your service has allowed our city to continue operations essential to the daily lives of our residents and our businesses as well. And from the beginning of this pandemic, the City Council and staff have been working very closely with our local and regional partners to fight COVID-19 and proactively plan for the future. Our number one priority through this all has been public safety, and now we have the opportunity to craft our next steps. Protecting public health will continue to be our top priority. We will continue to develop solutions using Arizona data and by following the guidelines set by our governor and president to flatten the curve and mitigate the risks of resurgence as we near the end of this. We will do this responsibly, and we want to thank our community for their patience, their cooperation, and their partnership. So tonight's presentation will begin with a situational briefing, followed by a review of the President's guidelines for opening up America again, the governor's executive orders, and city closures. City manager will be asking council to give direction on opening or leaving closed city amenities not specifically covered by the governor's executive orders. Our city manager will also be asking for direction on public participation in council meetings as we go forward, and seeking direction on appointed boards and commissions and their meetings. We will end the evening by discussing Chandler's returning to service plan for phased reopening of city facilities and programs once the governor lifts his executive orders and council gives direction to go forward. In a press conference yesterday, the governor emphasized that Arizona will return stronger. I believe in working together, we will return stronger. So let's get this started with our situational briefing. I'm happy to introduce our special guest this evening, Dr. Marcy Flanagan, Director of Maricopa County Department of Health. Before she held this position, Dr. Flanagan served as the Pima County Health Director, and she has degrees from both U of A and NAU. Council, you have submitted your questions to Dr. Flanagan ahead of time, and she has taken in these comments as part of her presentation, and if time allows, we will also have the opportunity to ask further questions regarding the status of COVID-19 in Maricopa County that will get us currently up to date. So, Dr. Flanagan, thank you for your time, and the floor is yours.
Okay, good evening, Council. Thank you for inviting me and allowing me to come and speak. So what I have planned is I'm going to do a brief kind of overview and presentation, and hopefully through that, most of your questions will be answered that were sent to me. But if not, we can allow for questions at the end. So to begin with, our current case count in Maricopa County is 2,963. Of those, we have almost 50 and 50% male to female ratio. We have 61% female and 49% male. Our most affected age group for hospitalization are those that are over 65 with chronic health conditions. And that represents 26% of our total cases, or 770 cases. Hospitalizations have been at 19%, or 550 cases, with 6% of those needing to go to the ICU and 4% experiencing death. Our death count in Maricopa County right now is 115. So So I'm going to talk a little bit about where we're at on the curve. You've heard a lot of people ask, what does that mean? Where are we at? Have we peaked yet? When do we expect to see a decline? So what I can tell you is that it's really clear on our epi curve, which is not a model, but it's actual data of what's trending in Maricopa County and what we've been seeing with hospitalizations and new cases in our county. And we saw a rise up until a couple of weeks ago where we have really plateaued, and we've been on this plateau and even started a very, very slight decline. And this has been hospitalizations. Because testing is not widespread yet in Maricopa County, the best indicator we have for where we are at is looking at hospitalizations for COVID-19. So that's what we're really watching. So according to what we see now, we do believe that we reached a peak and we're plateaued, but that will require us to continually monitor hospitalizations to watch how that curve is going to move. And so a lot of unknowns are, will the summer weather impact our numbers? And we don't know this answer yet. It may impact our numbers and it may not. Most novel viruses, and there's several of them, tend to be affected by environmental conditions, but because COVID is so new and we haven't seen it through summer and winter months, we don't know exactly how it's going to behave. If it behaves like other novel viruses, we do tend to see a slight decrease in the summer months, but that's yet to be determined. The next thing is, when would we be able to reopen our cities and government? And there's a lot of different plans for that, and we have some triggers that we're looking at. There's plans that came obviously from the White House and President Trump. There's a few others that have been released from different schools of public health, and they all have a few things in common. And it's really these three triggers. And one of them is that there's a decrease in cases, and that is for a 14-day period of a decrease in cases, that there's increased testing availability. And the third thing is the ability to manage hospitalizations without altering any standards of care. And they also all have in common that the most effective approach and best approach is going to be to do things in a phased approach, which means that you'll open up some parts and you'll wait and watch and see what happens to your epi curve. If it starts to increase too dramatically and the hospital systems start being overwhelmed, you start putting some of those mitigation efforts back in place. From what we have heard from ADHS and the governor's office is that they are looking to mirror or closely follow the president's guidelines to opening up America again. So if you look at that plan, there are three gating criteria. The first one has to do with symptoms, and that says that there will be a downward trajectory of ILI, which is influenza-like illness, for a 14-day period, and a downward curve of COVID-like symptom cases reported for a 14-day period. These are all syndromic surveillances that we do with hospitals throughout the year. Flu season, we always do this. So the ILI is something that is typical we follow in public health. The COVID-like symptoms is something new that we're monitoring, but those would need to be declining for a 14-day period. The second gating criteria is that there has to be a downward trajectory of documented cases or a downward trend of positive cases as a % of the total cases within a 14-day period. And then the third pillar of that gating criteria is that hospitals will treat all patients without crisis care and robust testing program in place for at-risk healthcare workers, including emerging antibody testing. And so once you meet all of this gating criteria, that's when you officially move into phase one. And once you're in phase one, how you move to step 2 and to step 3 is that you go back to these gating criteria and they happen again. So once we meet these 3 gating criteria, which we have not met yet in Maricopa County, probably the closest one we have that we are seeing is the hospitals are able to treat patients right now. And we're not quite there with the robust testing, but I think we're going to be there in the next week and a half. We haven't started to see a downward trajectory of documented cases yet. We're still at that very kind of plateau. We have seen a very slight decrease in our COVID-like symptoms and hospitalization, but it's not enough to start to say we can really start that 14-day kind of timeline. It's been so slight that it goes up and down and is kind of bouncing a little bit at this point still. So we still need to work on the robust testing in Maricopa County. We're hoping that we're going to see an increase in testing, but the problem with the testing increased capacity is that we need a few things in the supply chain to unkink themselves. One of them is the PPE, and the other is testing supplies. So when we are working several angles, and we have been for the past few months, of trying to get more PPE into Maricopa County. It's been months now that we have been putting in orders and they don't get filled, they get bumped. We've ordered now nearly $2 million worth of PPE and have not received any of it to date. So the only PPE that we have received and been able to distribute is our allocation from the Strategic National Stockpile. So we had to really prioritize this PPE when it came to public health, and we prioritized it with acute care hospitals, first responders, and most importantly, long-term care facilities. So as of April 23rd, we have distributed nearly 66,095 masks, almost 150,000 surgical masks, almost 30,000 face shields, 82,000 surgical gowns, and 180,000 gloves. And this was from our SNS and then also some of the donations that we have received. So the supply chain for PPE needs to get better, and we need to have that coming in constantly and consistently. And then the next thing is we need the testing supplies to be readily available. So you hear a lot of people refer to test kits. And when you talk about test kits, there's 2 things you could be talking about. The first one is the kit or the process and the materials they need for the capability of a lab to actually process samples and the materials that they get in the lab to be able to do this. These are not in short supply at all. There is a lot of capacity within the system, and there are a lot of labs available to do testing. The second part of test kit that you hear talked about is actually the supplies that are needed to collect the specimen. And so in a healthcare setting, when they collect a sample from a person, they use what has been referred to a lot as a test kit. And that usually consists of a couple different things. At the very beginning of COVID, it consisted of a nasal swab and then transport media, which is really just a test tube with some solution in it of how they ship off a sample. The nasal swabs that they would take an NP and an OP, that's like a throat and a nasal sample with, were in short supply. One of the major factors that happened was that the biggest supplier of these swabs was based out of Italy. And so when Italy was on lockdown and not able to produce any more swabs, that's really what kind of started the chain reaction. So in the last month, there have been the availability to start doing saline nasal washes, and then they collect the saline and the kind of goo out of the nose that comes from a saline wash, and they put that in a test tube and send it away for testing. However, that's not always preferred by physicians. It's not always the easiest test to perform in an office. So they really do rely heavily on those swabs. We're starting to see some more swabs being available, especially because they have allowed swabs that are more similar to a Q-tip to be used, and it's not necessarily an NP swab anymore. You can just take it kind of at the base of the nostril, which is much easier and requires a less medical grade swab to do that. And those are just hitting the market in the past few weeks. The quick result testing machines that everybody says the 5-minute test, those are the machines by Abbott. They are planned to be used at Walgreens. Walgreens currently has 2 drive-through sites in Arizona, one in Phoenix at El Mirage and a second one in Tucson. What you have to do to be able to go to one of these locations is take an online sort of survey of what symptoms you are experiencing, and then they will schedule you for an appointment for a drive-through test if you meet their criteria. The state also received some Abbott tests at the state level at ADHS. They provide 2 to Maricopa County. We put 1 in our jails with our correctional health team, and the second one is being used by Circle the City for all of the testing the folks that are experiencing homelessness. And these tests aren't meant to do large quantities of tests. The Abbott machines that were sent to us, it's just 1 test at a time that's able to be completed, and they actually can take up to 15 minutes per test for those. The other thing that this is kind of a, related is that being able to collect specimens for COVID testing requires the use of PPE. So I already mentioned the short PPE supply we have in Arizona. So this has compounded the testing not being as readily available as we would have liked or hoped at this point in the outbreak. So they both rely on each other. The PPE we need to do testing, and we need the testing supplies to be able to complete the testing. So those are really interrelated. And so once we see PPE and testing starting to become readily available, we are going to expect to see an increase in cases. And this doesn't mean that we have more people infected in our county. It just means that we have a better idea of what infection looks like in our community, which is going to be really important, because when we know that it's going to be really safe to open all mitigation efforts and that we're in, quote, the clear from this pandemic, it will be when we either reach herd immunity or there's a vaccine created that is readily available in the community. And we know neither one of those things happen very quickly. So testing is going to be vital to this pandemic. It was announced just yesterday that at-home tests are going to be made available. And so this should be also helping increase our testing capabilities in Arizona. We're going to be able to expand, or what's going to be really important when the testing does start to increase is that we start to expand our tracing capability. So you've heard a lot about this contact tracing in the news as well. And what contact tracing is, just to give a little bit of a epidemiology lesson, is it's when an individual tests positive and that result comes to us. And there is usually what happens when someone gets a test at a physician's office or at a lab, the sample is collected. It can take anywhere from 2 to 4 days to make it to the lab. The lab processes it. Depending on which cycle it gets put into, it may wait a day or so at the lab. And then those results are put into an electronic system, which are fed directly to Arizona Department of Health Services. And then Arizona Department of Health Services puts that information into our MESIS system, which is the system we use to send secure information about all reportable diseases. And that can take anywhere from a process, if it happens really quickly, 3 to 4 days, all the way to, you've heard some counties and some areas saying they're experiencing as long as 10 days for that to happen. But with contact tracing, what we do is when we find out about a positive case, we reach out to that case and we ask them everywhere that they've been, who they've had contact with, and then the contact tracing happens when we start reaching out to all the individuals that they've had close contact with, meaning they've been within 6 feet for more than 10 minutes at a time. And all along Maricopa County, a lot of larger jurisdictions, when they started seeing an increase in cases, they stopped doing actual case investigations. Maricopa County Department of Public Health has never stopped doing case investigations. We've been doing them since the very beginning of this pandemic and have never stopped. What we did modify was that we stopped doing intensive contact investigations, and we moved to a model where we would have the positive case notify their close contacts themselves. We would give them education materials and resources and phone numbers that their contacts could call us with any questions, but we didn't actually do the contact follow-up. We are moving back to that model with expanded testing and wanting to be able to look at opportunities to lift mitigation efforts. It's going to be important that we intensify our contact tracing again. So we already have a plan that we should have finalized by the end of the day tomorrow. We have a half-day working session to work out all the final details of that plan. We're working with our university partners to bring on staff. We'll be bringing on about 5 times the amount of epidemiologists we have right now on staff to be able to help with that contact tracing. You can imagine when we see 100, for instance, yesterday we had 120 cases come through. So if you think of 120 people and how many individuals they may have come in contact with since the onset of their symptoms, numbers can reach in the thousands quickly that our staff need to reach out to and have discussions with. And when they start having those discussions, they may be in contact with some of these close contacts on a daily basis if they're experiencing symptoms, or if we need to work to get wraparound services such as housing or food to these individuals. I mentioned a little bit the lag time on our EPI curve, and I think I went into details to describe it, but really it's the time it takes for a sample to go to the lab and then get finally reported to us where we start to do the investigation. And this is the same process that is used for all reportable diseases. It's very efficient and actually happens much quicker here than it does in a lot of other places throughout the world. I also know there was a question about hospital capacity, and it's hard to determine the exact number of tests being performed in positive cases that would say, is it safe to open? What we really have to do here is that, you know, just because more testing happens, it doesn't mean that all the individuals that get tested are going to need to be hospitalized. So that's why we, on a daily basis, all hospitals report to us their capacity, and we start to monitor and watch what the capacity looks like. Right now, capacity is very well at hospitals. As a matter of fact, they have more capacity at this time this year than they typically have in normal years during a flu season. So hospital capacity is looking really good right now, which means, you know, they can take in more individuals and treat them. And when testing starts to increase, and if we start to see more cases increase as mitigation efforts begin to be released, that's when we'll have to recommend more mitigation efforts be put back in place until we see the hospital capacity go to a level that they can handle it and they're not surged and out of staff to help treat patients. So I think in that presentation, I tried to anyway answer all the questions that came through to me, but I'm happy to take any questions you guys have for me right now.
Dr. Flanagan, how much time do you have left?
As much time as you need to.
Very good. All right, why don't we start this end, and if you have a question, we'll start. Councilmember Stewart.
Thank you, Mayor, and thank you, Dr. Flanagan, for your time and for the information that's very thorough, and we're grateful. So there's been a lot of talk about antibody testing recently. Can you speak to the accuracy of that testing and what that actually means from a herd immunity standpoint, please?
Absolutely. So what this kind of testing means, it's serology testing. And so this is not a test we would want to use for diagnostics. This is not a good measure of saying if somebody is COVID positive or COVID negative. It's not intended for that. What it's intended to measure is that someone has antibodies built up in their system. And so this means that it would tell us if a person was asymptomatic maybe and had COVID and didn't even realize it. And so they have a natural immunity built up without kind of realizing it or ever having been tested. Or it tells us an individual has not been exposed and does not have any antibodies or immunity in their system. The weakness of a test like this, one, I already mentioned it, it's not meant for diagnostic testing. The second part is that depending on the level of sensitivity and specificity, these can be hard to really measure, especially these novel viruses, because what they've seen in some of them is that it picks up antibodies and immunities from prior novel viruses that an individual may had. Typically, these immunities don't last a lifetime. It's, there's certain vaccines that we get on an annual basis, like the flu, that the antibodies don't last long enough in our system. There are some where you get your series of vaccines as a child and they last your whole lifetime. So the concern with this serology test that's out there right now is that this particular COVID-19 has not been around long enough to really have the perfect serology test for it. So the serology test is going to help and give us a really good idea, especially in situations where you have individuals and like in a congregate setting and you want to know who you can cohort together. It would be good to be able to cohort those that show they have immunity as opposed to those that don't. But to be able to really tell someone they may get it or they may not get it, it can be difficult because they may have be early in their having COVID, and so the antibody test isn't going to pick it up, or it could be the case that they just had a very, very mild version of COVID without realizing it, and so it doesn't pick it up in those cases either. So they're all a little bit different. The University of Arizona is doing a study with their serology test, and I know they plan on doing 250,000, upwards of 250,000 tests throughout Arizona, which is going to give great information and data, but it's not what we would recommend or rely on to diagnose individuals.
Councilmember McClemens.
Do you, what states in the United States are excelling in testing?
So I couldn't tell you the exact states. What I can tell you is that when there started to be some hot spots in the U.S., such as New York, Chicago has some, Seattle, the federal government stepped in and started doing an abundance of drive-through testing in those areas that they called, quote, hotspots. And those were hotspots received their priority PPE and testing supplies. And so the problem, what was happening with the states that weren't these hotspots, that weren't experiencing a high number of cases, is that we were getting our supplies bumped off orders, and the federal government was intercepting our PPE supplies. That has lightened up. The federal government actually announced just a couple of weeks ago that they were not going to do the drive-through testing anymore, that they were going to pass that along to the states to take over testing. So I know Texas had a pretty abundant testing, and so have any of the other states that you think of as having high numbers at the very beginning. It's because they had so much testing going on. So you can think of Colorado, California, Washington State, New York, all of those have lots and lots of testing that's been going on for quite a while now.
And one follow-up question. So try to understand, Arizona, we have a lack of ability to test in a massive quantity. But understanding metrics, how much capital do you put in, measuring deaths as metrics? And what I mean by that is, those that have COVID-like symptoms seek out medical care, and maybe they don't get tested in a timely fashion, but they do get tested. But the ultimate result, the worst case scenario, is death, and those are numbers that we can rely on based on data. And so, based on death, the number of deaths that have occurred in Arizona, per 100,000. I mean, could you extrapolate any worthwhile data out of that on how prevalent the COVID is in Arizona?
Yeah, so we actually just started looking at death data, and not just the deaths that occurs in hospitals. We started working with the Office of Medical Examiners to actually have tests performed on individuals that died at home, that anyone in the household had respiratory symptoms or issues happening, or that individual may have respiratory symptoms or issues. And so it's going to take a couple weeks, or I would say even a month worth of data collection from that to get a real good picture of what mortality rates are looking like in our community. Because we were only getting the initial death data from hospitals, it's not going to paint a realistic picture of what the mortality rate is. It's going to be an over-pronounced mortality rate because it's only the individuals that were hospitalized and actually tested for COVID. So once we start collecting the mortality of all individuals in our community that may have passed away from COVID, we can then compare that with the entire population, and we'll have some really good data on what the mortality rate looks like in our county.
Vice Mayor.
So if I could ask maybe two follow-ups, I have a primary question, but a follow-up question, or question on that one is then how long or prevalent is the virus for testing of COVID? Because again, I mean, there's other restrictions for embalming, treatment of religious needs of treating the body prior to. Is that something that is easily gathered? And again, I don't know how far you go back, because again, some of the deaths might have occurred 2 weeks, 3 weeks ago. Are those numbers just going to flood into that day's collection, or are they going to go back to date of death?
So I think I understand your question, and tell me if I'm not hearing it correctly, but I think, so what is happening now is that, and this just started a couple of weeks ago, is that we're not going back on deaths that had occurred a month or so ago. This is on a go-forward basis, that anytime an individual passes in their home, and that's reported to, or on the documentation that goes to a funeral home, we have an arrangement with funeral homes that they are collecting the swab of their nasal, which all research shows that it's still going to be present. If it was present in their system, that COVID will still show up in the test results. Those are then sent to the lab, and we're given notice if those were positive for COVID. Does that make sense to you?
Yeah, so it's again, just you're setting a new scope of testing then to include deaths, because then in prior data that we're going to have a step up in a plateau, because again, you're adding in new deaths that were never accounted for prior to 2 weeks ago, though, correct? So
correct.
Okay, as long as I understand. My primary question was around the cases themselves. So you mentioned it's one of the gateways that we needed to pass, or toll gates we need to pass through in order to meet the requirements to start hitting into phase one. You talked about the cases, the number of cases that wound up coming forward, or being on a daily basis, that we start seeing a drop. Now, does that take account, or is that normalized, one, against the number of tests issued, i.e. if, again, a batch comes in and all 50,000 tests get issued that week, versus the previous week that only had 10,000 on hand, and all of a sudden now there is 5 times more cases that week because there happen to be more tests made. Does that get normalized also?
Yes, so that means that the positive cases are a percent of the total tests within a 14-day period, because you're exactly right. You can't go on the straight percentage because if the number of tests increase or decrease, it wouldn't give you an accurate percent. So it's an actual percentage of the total tests of each day of what came back positive from that day. And that's what needs to show a downward trajectory. And so then that doesn't matter how many tests are done or not done. It's just the percentage that are positive.
Okay, because most of the graphs I've seen have only showed, again, a total number of cases. It has never really shown a normalized number, so that would just be, I guess, hopefully somebody that's revaluing that data for that purpose. But then, as another side set of that, is there also a submetric that is being analyzed for those that exhibiting symptoms and or hospitalized? I think that was asked previously, because again, you can have 1,000 cases with 500 being hospitalized and or showing symptoms versus 10,000 cases, but only 10 people being hospitalized. I mean, is that also being normalized for cases versus hospitalization versus death that are being shown?
Yeah, that's exactly what an epi curve does. That's the difference between a model. A lot of the things that you have seen have been a model, which they're just straight numbers. They're not going to take into account all these other variables and sub-metrics and kind of circumstances. And so the downward epi curve is what we're looking at of influenza-like illnesses within a hospital and COVID-like symptoms. And that's a percentage, and it normalizes for the number of individuals being tested and whatnot. All that's taken into account.
So speaking of trajectories, I'm noticing that Councilmember Stewart asked one question, McClymonds 2, now Lopez 3. I hope this trajectory doesn't continue. Councilmember Wong.
Okay. I do have friend. Thank you. I do have friend got infected and recovered, and according to her, she waits a long time before she can get tested, and also she waits more than 3 days to get a result, and also she was not quarantined. She was sent home, and she was advised to stay home, don't go anywhere. But there's no any tracing or whatever. It's not mandatory. So it is not really the case still now, or? Yeah.
Yeah, so what I can speak to with that is a few things. It sounds like where she went to get the testing done was the test was sent through a private lab. And so when tests are done through a private lab, we only get the results of a positive case. And so it would, the advice that she was given of going home and not going out, that is quarantine. And she would only hear from public health if her test came back positive. And then that's when we would start doing our contact investigations and doing wraparound services and stuff. So right now, the advice for everyone is, if you have those symptoms, stay home. If you go and they believe you're have symptoms consistent with coronavirus and they perform a test on you, and this is going to be whether an individual goes to drive-through testing, whether they go to an urgent care center, whether they go to the hospital, their healthcare provider, in all of those circumstances, if they're not having difficulty breathing, they're going to be told to go home and self-quarantine until they get the test results. And then if the test results are positive, they'll be notified, and then that's when they'll be contacted by public health. But hearing that it took about 3 days to get her test results back, that seems pretty consistent with private labs. If you were in a hospital setting and having difficulty breathing or had very severe symptoms, her samples would have been sent to the state lab at ADHS, and those results are usually back within 24 hours.
My second question is about the reopening. It sounds like the guideline we have is pretty, in my opinion, is pretty passive. We are waiting for the number to go down, and then we open a little bit, and then we wait for something to open a little bit. But when we open, if we don't really do anything more active, when we reopen it, it only means we got more chance to get infected. So I'm not here to make any recommendation, but I just want to say we got to have more not passive way for reopening. We need to do some preparation or apply some kind of measurement. So when we reopen it, we are not going to increase the cases. Yeah. So my third question is.
So, Sam, we're going to restrict people to questions. We've still got a good hour and a half here of our session, so why don't you make this your last one?
Okay. The third question is, are we going to recommend people to wear masks?
Yeah, so let me talk just a quick point about what you were saying about opening up and being proactive and all of that. We do know, and we expect this to happen, that as we lift some measures and as the governor decides to allow some folks to go back to work or some businesses to open back up, we are absolutely prepared and expect for cases to increase. That kind of has to happen until we reach herd immunity or have a vaccine available. So that's very normal for a pandemic and for an outbreak. But what you don't want to do is overwhelm the system. And so that's why it's this take a slow approach. We expect this to be very cyclical until we reach that herd immunity or vaccine. The other part about masks is that the important part is to realize that when individuals wear masks, they're actually protecting others from themselves. So if I wear, especially the cloth masks that we're recommending, it's so I keep others safe from me. So if I have symptoms. And for certain populations, it's always going to be important for those individuals to wear masks and to really limit their time in public. And that's going to be those individuals that are over 65 and have underlying health conditions. They're going to be the last population that really be encouraged to go back out and socialize and whatnot again. You're going to see the restrictions that are on long-term care facilities and visiting stay in place to the very final stage.
Councilmember Rowe.
Thank you, Mayor. Dr. Flanagan, thank you for taking time to talk to us tonight. As we go along on this very bizarre journey, there are some procedures that are going into place that are recommendations. But what I'd like to know is that are there any therapies that are kind of being widely adopted that are providing some improved outcomes? Are we seeing some nice saves because of things that we're doing, and is that something that's promising, not just in Maricopa County, but across the country? That's my question. Thank you.
You're welcome, and thank you for having me. So there are a few things that are happening. So you've heard a lot about the chloroquine, and what that has had mixed results. For some, chloroquine has been shown to be effective, especially in combination with erythromycin, but then you've also seen where some other therapies have been useful in some cases. Nothing has been widely studied enough to really be able to say it's an approved therapy or treatment. There have been, the FDA has allowed some emergency use authorizations, which means it doesn't have to go through the normal stringent FDA guidelines to be approved to be used on a patient. And it's going to be up to an individual physician whether they think it's an appropriate treatment or not. What I can tell you has been effective and has saved lives is that what they're noticing is that individuals decline quickly. And a lot of times the problem is that it's just that they're barely having some issues with breathing. So they go to the hospital, and it can be literally overnight that their lungs collapse and they just get to a point that the hospital cannot save them. what has been done, and there was a great article that came out, I believe in the New York Times earlier this week, but they started measuring saturation rates with your blood, and you know, it's a little measurement they put on your finger that watches your heart rate and your oxygen levels. When they start to see a person's oxygen saturation drop, the sooner they get those individuals on assisted breathing, whether that's just less invasive, like a nasal cannula, or eventually even to full intubation, they are seeing a higher success rates with individuals not dying as a result of COVID. So that's the only thing that I've seen that has really gotten to a point where we're looking at buying those little blood oximeters that are portable to give to long-term care facilities to regularly check the you know, oxygenation levels of patients in their care. But as far as treatment goes, there's been nothing yet that's been proven totally effective for everyone. They're really seeing individual cases that are having good results with some of these treatments, but it hasn't been across the board.
Councilmember Orlando.
Thank you. Doctor, thank you very much for taking the time out tonight. I really appreciate it. It's very enlightening. So I want to just clarify one thing, and then I have a question or two here. Of all the triggers you mentioned, both the state and the federal, other than the ability of hospitals to treat all patients, we're not there yet. Is that correct?
So we are able to treat all patients at this point in Arizona, in Maricopa County. So we're doing really well on that end. Is that what you were asking?
Yeah, no, other than that one, I said, we're not there. The other 6, you mentioned 3 in the state and then 3 from the federal government, right?
Right. I see what you're saying now. You're correct. Yes,
Okay.
That's the only one that we are, have met.
Okay. Just real quick, you know, we've been reading where other countries that are ahead of us, particularly the Asian countries, they're experiencing second and in some cases third waves of positive tests after they reopen. What are our plans to measure metrics when we do start opening, whether it's through tracing or cases, to be able to leave the throttle back or shut down? What are your metrics are you looking at?
So these are going to be the same, definitely in Japan and Indonesia, South Korea, China. Some of them are saying they're experiencing second waves. What we don't know and what we're really hoping is that it's not a second wave where COVID is reinfecting individuals. We're hoping that it's the case that these are new cases, that none of these countries have reached full herd immunity. So I think when they do a second wave, it's an increase of cases after they started to open up their countries again and open up isolation efforts. So what we expect to see here is the same exact kind of trend. Individuals may be saying a few months from now, we're seeing our second wave. And that's going to be expected. So the message that you'll hear a lot from public health when that happens is that this is what we expected. This is what we knew was going to happen. And we're going to see this type of cyclical pattern for the next year or so. So people may, you know, 2 months from now say that these same countries are third and fourth wave and so on and so forth. So again, it'll go back to those 3 kind of pillars or gating criteria that will really start to measure things, and that'll be the influenza-like illnesses, the downward trajectory of cases, and the hospitals being able to treat individuals. When we become overwhelmed in the hospitals, that'll be the sign where we're really concerned as public health officials, and we think that we need to really go on strict isolation measures.
Okay. So I heard you say a couple times, as we enter the fall season, what can we do to prepare for any potential outbreaks as a city, just to be prepared? Is it just a matter of the same old stuff, more PPE, training, mask, that social distancing, that type of stuff, or is there more we can do to prepare for the fall season?
Yeah, I think what's going to be important in the fall, besides what we're already doing, is going to be getting the flu vaccine widely administered. Part of this is because we're not going to want to confuse individuals with COVID and flu and overwhelm the hospitals with both of these outbreaks happening at the same time. We saw it early on in this, that the hospitals were a little overwhelmed at the beginning, but as soon as flu season started to go away, this is when their capacity really opened up in the hospitals. So in the fall season, it's going to be as important and as much as we can to do wide flu vaccines in our community. That's what we're really going to be pushing from a public health standpoint. And you'll start hearing a lot of that, especially come August when the new flu vaccine comes out. You'll see a lot of efforts for us to get as many people vaccinated with the flu as possible.
Thank you, Doctor. One comment, or hopefully a bright spot, is listening to the President's presentation today. One of the epidemiologists there had mentioned a study being done on the effect of heat and sun rays on the sun on potentially being a sanitizer for outdoor, or at least heat. And it's too early for us, obviously, to know that, but hopefully that might have a increased dampening of impact on Arizona. So any thoughts on that?
Yeah, definitely. For other coronaviruses and other novel viruses, the heat is absolutely our friend in killing virus and bacteria on especially those high-use things like door handles, doorknobs, buttons that we push that are outdoors to allow someone to come in a door and whatnot. So all of that, we're really crossing our fingers and hoping to be the case. We do know that just basic cleaner, you don't need any special cleaner to clean the coronavirus from your household right now. We don't, when business or company or anything says we had an employee with a positive case, do we need to use any special sanitation measures? We don't. So the nice thing we know about this virus is it does die pretty easily on a surface with just regular old household cleaning products. So we're hoping it behaves the same way as the others when it comes to heat, and that heat will kill it as well.
Well, thank you, Doctor. Any final comments on your part for us, or wisdom?
Not on mine. I think that we've really appreciated the partnership that all the jurisdictions have given us. We do have a weekly call on Thursdays with all jurisdictions. You're more than welcome to have a representative call in or watch those webinars. And we always give up to date where we're at on information and take questions at those as well.
Well, thank you. I believe our fire chief listens in on those every week, so we get up to date on that well. Again, thank you for your patience with us. I know this was a longer time as well as a later time than we had requested of you, so thank you very much.
You're welcome.
Have a good evening.
You too. Bye-bye.
All right, Council, we can go home now. Just kidding. There's other parts to this beyond this presentation concerning requests and other information available from the city. Councilmember Orlando.
Mayor, I'd just like to, if we could have staff send a letter on your behalf, this council's behalf, of Doctor, and thanking her for all her activities, what she did tonight, and enlightening us, not just us, but the Chandler residents of Chandler. So if you could do that get the mayor to sign that, appreciate it.
We got our communications folks here. We can get that done. So thank you. All right, City Manager, I'll turn this back over to you, please.
All right. Thank you, Mayor, Council. I know it's getting to be a late evening, so we'll try to go fast. Based on our conversations that we've had in the last several weeks, I know there have been a number of things that have come up and questions that you've asked me in regards to this whole situation. I really do appreciate Dr. Flanagan spending the time with us tonight, but just wanted to continue to lay kind of the landscape out there for you all as you start hearing from the governor and then making other decisions. So we'll continue that, and I'll get Micah Miranda, our Economic Development Director, up here to talk about the economy that we're seeing out there today.
Micah, be sure you clean that off when you're done. One person I didn't need to remind.
Yeah. Got my own dispenser on the wall on the 5th floor. You all thought that was communal, but it's really there for me. So thanks, facility. Take care of that. So as we all know, the global economy has been rocked. A lot of the measures put in place to limit the spread of COVID-19 have had a major effect on consumption, and it's really disrupted a lot of the business climate, both on the demand side and supply side throughout the supply chains. So we're really taking a look at some global and some macro things here. On the global side, one projection now, and it is just a projection, and this is based upon the IMF, is that during the Great Lockdown, there could be a 3% global contraction. To contrast that, during the global financial crisis, that was a 0.1% reduction in global GDP growth year over year. On the US side, during the Great Lockdown, we saw, we're projecting, again, these are projections, and it's all based on how quickly we open back up, but projecting a 6% year over year pullback and comparing that to the global financial crisis of just about 3%. So depending on how quickly the implementation to limit the spread goes into effect, it's going to have a major impact on how successful the global economy responds. Here, retail sector is something we keep a close eye on. Consumption is approximately 70% of the US economy, and so it's a pretty good indicator of what's going on. Retail and food sales across the US were down 8.7% March to April comparison. And to the right, we have a graph that really shows where those retail sectors have been impacted the greatest, specifically in clothing, accessories, furniture, food service, motor vehicles. On the positive side, building materials and gardening equipment is up. People are out doing home improvements, things like that. Non-store retailers, those are your online purchases. We hear a lot about the increase in delivery, but from a national perspective, online retail sales, while they are surging, they're still a very small percentage of all retail sales. And then food and beverage sales at stores has increased by about 25%. On the left, you see that major 8.7% decline. You look at that compared to the last two recessions of 01, 08, 09, and it was pretty quick. And we're going to have another slide later on in the presentation that kind of shows the inverse of that as it relates to unemployment. Restaurants, another good proxy of what's going on in the economy. You've all probably heard me talk about my Olive Garden economic indicator. If you go to Olive Garden on a Tuesday night, stand outside and there's a line, things are good, right? People are out there spending, a lot of confidence in the economy. We've seen a major downturn, 43% year over year, and that's very cyclical. And so we'll continue to track this as well. Economic development, our strategy calls for tourism. It is a pillar of our economic development strategy, and a good proxy for that cluster is occupancy. Nationally, we saw about 22% occupancy of our hotels. Chandler, we're no different. We're higher. We've been lucky that we haven't seen quite as dramatic downturn as our national partners have. And we've been fortunate, and I'm going to talk about this with a little bit of specificity as it relates to the property type. So luxury class is just getting killed. There are less than 10% occupancy. It is a luxury item. People are pulling back. Where Chandler really excels is in the upscale, upper mid-scale, and mid-scale classes. And that's really around business travel. A lot of those hotels have kitchenettes, and so they can accommodate the business traveler. So those property types are doing relatively well in this economy, which is something that's an advantage to Chandler because we have that product type. Unemployment, it's going to be hard to see because it's over such a long time span, but really to the right of the first graph, you can see there was a major spike in unemployment requests over the first 4 weeks. 5.2 million people filing, 22 million people in the US filed for unemployment, with 5.2 in the most recent week. In Arizona, the industries that have been hit the hardest are accommodations, food service, ironically enough, healthcare, social assistance, and retail trade. Now, those are 3 areas I want us to keep an eye on because, question?
Councilmember Lopez, a question.
Well, along those lines, I'll let you finish, but the number of claims, is it correct or that I read that the change in category though of those able to claim unemployment also changed, or is that not correct?
The change being due to layoff, furloughs.
Well, I thought it was a statement that there were, again, self-employed that before couldn't claim unemployment. Some of the other categories of employees, example, Uber drivers and stuff, they were now able to, whereas before it was a side job, either through college kids or teachers or whoever. I mean, my cousins did it also. They couldn't claim unemployment, but now with some of the changes with, in the rules that they were now able to claim. So I was trying to figure out if that is correct or if that was something that was more anecdotal.
Through the mayor, vice mayor, we have heard that there have been some tweaks in who is eligible. Those specific employees, I'm not quite sure on, and we can do some more research to really dial down on what employment sectors are allowed to claim it because of the changes in the CARES Act.
Okay, thank you.
Continue.
So in Arizona, the leading unemployment cases came from accommodations and food service, followed by healthcare and social assistance, and then retail trade. But this is where Chandler is in a good position. Our economic development strategy, as historically been presented and supported by mayor and council, has really focused on a diversified employment cluster. We don't have all our eggs in one basket. We like to have balanced revenue streams, and this is really where Chandler's economic climate is going to serve us well during this particular instance. So across the U.S., total industrial production was down about 5.4% in March, and manufacturing output was down 6.3%. However, that's across all type of industrial manufacturing, and so in Chandler, we have a really healthy manufacturing base that hasn't quite seen that downturn, specifically around semiconductor production. That's one of our major economic bases around semiconductor production. That's been down only 0.1%. So from that perspective, we're competing, we're performing very well compared to other parts of the country. In one instance, motor vehicles have seen a 28% reduction in production. So we have some really good things going for us in just the way our economy is structured. Taking that a step further into those specific industry clusters, we've taken a look at those and compared Chandler to the metro, state, and national levels. And again, looking at the right side, manufacturing and fire, financial, insurance, and real estate, we're really outproducing our employment as opposed to the regional, state, and national level. So we're not being as heavily impacted in those sectors. So that puts us in a pretty good position relative to the rest of the country, which is, again, part of our economic diversification strategy. We've been up here and we've talked about not always wanting to have our eggs in one basket. So from that perspective, we're very competitive, and it may provide some advantages for Chandler as we progress through this pandemic. And one of the things that I don't want to be lost on the community is our fundamentals haven't changed. Chandler is what it is, and those things are based on a diversified economy. We have an educated workforce, which is going to be paramount, not just because of the pandemic, but going forward, we really continue to drive economic excellence based around a quality workforce. And then political stability. Mayor and city councils have had a very rational approach to managing the city, and our commitment to financial discipline. Our policies and procedures that we've put forth through previous city councils, city manager's office and budget have provided us a lot of credibility within the business community and our regional partners as a destination that is stable for private sector capital investment. So that's something we should be really proud of. And that is it.
Did I hear you say we have a rational or irrational approach?
Rational.
Thank you.
Thank you.
All right, Mayor and Council, I know Dr. Flanagan spoke briefly about the guidelines under the Opening of America announcement, but Chief Tom Wiggins is coming up and he is going to talk about those. A bit repetitive, however, we do have some charts to go along with each of those gatekeeping areas that he's going to go through.
So I have to follow Micah, which I never like to do, and then the director of public health took all of my thunder, so we'll see how this works out here. But I am going to speak to the Opening of America announcement that occurred last week. It's important to know that there's two parts to this. The first part is the gating criteria. That's what Dr. Flanagan spoke to. And what's important about that criteria is I see it almost as a progress report or report card, in that every part of the phase that we go through, you are essentially going back to that gating criteria. So you have a 2-week gating criteria, you go into phase 1, which is 2 weeks long. They reevaluate gating criteria. If you pass that, you go to phase 2 and then into phase 3. So it is extremely important that we understand what this is. As Dr. Flanagan said, it's broken down into 3 different areas: symptoms, cases, and hospitals. And I'm going to speak to each one of them very quickly, but I'm going to show you a chart that I received from Arizona Department of Health Services yesterday. Some of this information is up to date, and some of it's still about a week behind, and that's normal in epidemiology, is that as they're getting information in, they update these charts. But the first one that she spoke of was the ILI, or the influenza-like illnesses. And these are patients that are seen in the ER or in the hospital setting, the inpatient setting, that have flu-like symptoms. Now, how do we differentiate that between COVID-19? Because they look the same. With the flu, it's a fever, it's a cough, and it's a sore throat. With COVID-19, it's a fever, it's a cough, and it's a shortness of breath. And so really it's that sore throat and shortness of breath that differentiates the two. As you can see in this chart, the red line is for the ERs, and then the gray line is actually the inpatients. We have seen a decrease in the flu virus over the last month and a half. We were told by public health early that a lot of the suspected cases of COVID-19 were actually testing positive for flu. But as the month of March went on, we started to see that change. We started to see the flu cases decrease, and really the COVID-19 numbers and lines, they actually innervated, so they switched places. But this is reflective of the ILI, and as you can see, we do have a downward trend in that. As far as our COVID-like illness, or our CLI, same thing. The red indicates what they're seeing in the ERs, and the gray is what they see in the inpatient hospital setting. We had a really good spike, and that was in March, right around March 19th, March 15th, and it looks like it just leveled off there, especially in the ERs, and then when we hit April, it started to come down. And so this, what she was referring to with her data, was county data. This is state data. And one thing that we have seen is that each county within our state is not the same. There is differences in the numbers. We're seeing differences in the trends. And so this is really encompassing the entire state. But we have seen a downward trend. I know that I have spoken to our 2 main hospitals, which is Mercy Gilbert and Chandler Regional Hospital, and they have confirmed that they have seen a slight downward trend in their COVID-19 cases. One thing that is important is that not all of these cases are tested. So these are not confirmed positives. As you guys know, we had tents out in front of Chandler Regional Hospital and Mercy Gilbert, and their initial process was to push people through tents that had these types of symptoms. And if it was basically that the patient was stable, they would actually send them home. They would treat them with whatever they could, but they would actually send them home and not test them. So these are not all tested patients. These are just symptomatic patients. Okay, so that is the symptom side. Then there's the case side. And you can see here, this is a graph from AZDHS. This is our daily case increase or case count. You can see the lower numbers. It seems like there's 5, then 2. Those are our weekends where we don't have as much testing going on. And then it seems like we get a spike in that Monday. This is not complete yet. They're still finishing the numbers for this week. But if you listen to the governor yesterday, when this slide came up, he specifically said there is no trend. And so however you want to take that, if that means we're plateaued out, they're not seeing a trend on this. Now, Vice Mayor, you asked a very good question, because in the gating criteria, we are asking for more testing. And when we start testing more, those numbers are going to spike up. So Dr. Flanagan spoke to, we need to look at the percentage of positive tests versus the total tests on a daily basis. And that's what this graph is right here. You can see, this is actually on a weekly basis, but it shows you what our trend line is. The gray is the total tests that are conducted on a weekly basis, and the red dot is the percentage that are actually positive. So you can see it in March 15th, we're at 5%. We went to 7, 9, 11 on April 5th. And then this week, going into this weekly period of 419, right now we're at 10%. And as they update that, we'll see where that percentage goes. One thing that Dr. Flanagan did not say is that this is the only part of the gating criteria that's an or. So it's either a decrease in daily positive tests or a decrease in the percentage. And I think that most people will probably defer to the percentages just because everyone should be increasing their testing.
Mayor.
Thank you, Chief. This is great information, like phenomenal information, and some of the information you provided already is telling. If, let's say, for example, some people all went to CVS or the Walgreens in Tucson and they said they had symptoms or showed symptoms and they got tested, but they all came back negative, wouldn't that skew that data the wrong direction? For example, if somebody were trying to game the system, or like, how do we count on that? And what is that gate where I've not really been clear on what that gate is for being able to get tested. It seems like some people can, some people can't. And I know you have a great way of creating clarity on these things. Could you help me?
Through the mayor, council member, so what you're saying is if people showed up, said they were symptomatic, but they weren't, just to get tested and be negative, so then you would decrease the total positives. I mean, I guess you could game the system that way. I don't know why they would do it. I don't know what the process is to validate that you truly have symptoms. I do know that fever is one of them, and it's been a long time since I was in school and tried to fake a fever, but it's tough to do. And so, I don't know how much latitude some of these urgent cares or these clinics have in actually testing. But potentially, yeah, I mean, if you were giving more tests to people that were not symptomatic, it would skew the numbers. It would actually drive the positive percentages down because you would have more negative tests. And then what was I apologize, your second question on that?
These two metrics, one, and Councilmember or Vice Mayor Lopez alluded to it earlier, is that as we get more testing, those numbers are going to go up. So it's really the per capita that we're looking at for positive cases, not necessarily the flat out numbers. So
that is great information that is now being shared on AZDHS. Right when you go to their data analytics page, there's a drop down where you can go per capita, and they do all of these per capita. So they are doing that. Councilmember, over the last week, it seems like every week they get a little bit better and better in sharing their data, and they're starting to create better platforms. And I know that they are continuing to drive in that direction. The nursing home data, from what I understand, is going to start to come out a little bit pretty soon here. And so hopefully we can see a lot of these data points that all of you guys are asking about are being asked by everyone, it seems like, in the healthcare profession right now, and we're starting to see.
Councilmember Orlando.
So Chief, on that chart you just showed, you said a 4 to 7 day lag time. Is it the time they took the test that's added to that week, or the time it was reported back?
Through the mayor, council member, it's going to be the time that they reported back. So once they get the results from the test, there's a reporting process that is now required from PCP, from urgent care, standalone ERs, hospital groups. They will have to report that through their channels, whether it's Maricopa Public Health or AZDHS, and then they do up the numbers. We have seen fluctuation in the numbers. You may note a specific number, on a daily period, and you could come back 4 days later, and for some reason that number can go up or down. So there is a little bit of fluctuation there, but I know that it has to do with the reporting part of when they report it. Okay, so that really takes care of the symptom side, the case side, and then the last thing was the hospital side. And I feel very confident in speaking to this, is that there is capacity in our hospitals right now. This is a chart from AZDHS on the ICU beds available. I know that I've had an opportunity to brief all of you that even though right here, if we look at a potential trend or baseline of 70%, that seems full on a normal basis. But I think Dr. Flanagan reiterated that they are used to going way over that 100% mark, and that these hospitals do have contingency plans in place where they can create more beds within their facilities for ICU use. And so what you see right here is actually not the norm. The norm is that red bar probably coming all the way up to 100, maybe to 110, 115. And certainly, to her point, when the flu virus is prevalent, those numbers are way up there. And so, one of those gating criteria was that your hospitals can treat patients without relying on crisis care, which is what we're seeing in all these communities with the tents, the additional staffing, the pods that they're making. As I said earlier, Mercy Gilbert is bringing theirs down. They've already brought their tent down. Chandler Regional is bringing their tent down, or it might be down right now, but they're going back to normal operations, and that is because that they feel extremely confident that they have the capacity within their facility to not only handle their current workload, but if there was a surge, if we did reopen, that they would have capacity to take care of the surge as well.
Vice Mayor.
Chief, is there a surge number that it says 50%, 100%, 500% of X cases, peak cases, going back to the peak? I mean, is there a defined surge number that is to be met in order to, again, keep on meeting this toll gate?
Mayor, Vice Mayor, I'm not sure what that number is or was. I know that at one point they thought that we would not meet it, and that is when they opened up or prepared to open up St. Luke's. But everything that I have seen, I haven't seen a specific number, but I have, and I believe at the governor's press conference again yesterday, they said they have plenty of room, and that they feel very confident that if the new projections of a peak in May or June does arrive, that we will have plenty of capacity to handle it, but I don't have a specific number for you.
Yeah, thank you.
Okay, the final slide I have here, and that was really the last piece, and that was the robust testing, and it was for healthcare workers. That's obviously in an effort to ensure that our healthcare workers are being tested when they become symptomatic. One thing that we have to make sure that we do as a city, that we do as a state, that we do as a nation, is protect our vulnerable population. We've already seen it here in the city of Chandler and across the country, that this virus is extremely dangerous when we have someone who is 65 years or older that does have an underlying condition. And so it's important that we test our healthcare workers so that if they do get this virus, we can quarantine them. We can do all of the tracing to see who they have talked to, who they have touched. If you look at this number here, this is our testing. Again, this was pulled yesterday. We've conducted a total of 56,601 tests, and right now we're at an 8.5% positive test rate, and that is the state data. One thing that Dr. Flanagan did speak to was the serology testing, and that is still something. They're not just looking for diagnostic testing, which is you are positive or negative. They still want to see the serology testing to determine who has the antibodies. One, that's a really good indicator of herd immunity to see how many people have it. But two, maybe you've seen that people can now donate plasma, and they're thinking that because they already have the antibody within there, they can donate that plasma and they can start helping patients that actually had the virus as far as a treatment modality. Okay, I believe that is all I have on the gating criteria. Any questions?
Any questions? All right, thank you, Chief.
Okay. I'm going to go right into the next slide. So that is the national level. I think we're going to just take 2 minutes here really quickly to just talk about what we're seeing here in the city of Chandler from a public safety perspective. I'll go first, and then I believe Chief Duggan is coming up. So just some of our statistics. We talked about the COVID-like illness, what we're seeing in the hospitals. That is something that we look at on a daily basis as well. Right now, we're seeing on average about 3.5 CLI per day, which is actually down from what our peak was, which was about a 4.4 over a 2-week span. Our CLIs in nursing homes obviously has increased. I know some of you have seen the stories. That is something that is our top priority right now. We are talking to nursing homes every single day. We have worked with them to ensure that they have PPE. We have lent them some of our PPE. We're talking to them about their protocols. Whatever we can do to help our nursing community, we're going to do. We have over 286 residential and commercial care homes within our city, and we have had captains from our EMS staff call every single one of them to check on them, to see what they need, to make sure that they have the right resources at public health or AZDHS, and it's been extremely successful as far as building that communication channel. But we still have had 42 911 calls at our nursing homes where they did have CLI-like symptoms. Positive cases, that's from the state of Arizona. As you know, they put out the zip codes. This morning, we updated that. That's at 215 now. One thing I just want to note is that 2 of our zip codes one of them goes into Sun Lakes, and one of the zip codes goes into Gila River. So even though that represents the total number of our zip codes, it's probably a little bit less because we're picking up Gila River or Sun Lakes cases. And then 72% at our hospital capacity. That speaks specifically to Mercy, Gilbert, and Chandler Regional, which means right now as we speak, they have 28% as far as in their hospital to treat patients. My final slide here is, first of all, our daily PPE. That is something that we are monitoring every day. When the crew finishes their shift, they call in to a centralized location. They have to talk about how much PPE they've used. We track all of the burn rates, and we know what we have on hand as far as our supply. Right now, we have 140 days of goggles, masks, gloves, and gowns. So that means we have everything that we need. 140 days may not seem like a lot, but we are positioned much better than most of the fire departments around us right now. We were very lucky that we had a good supply on hand, and we've received some donations from AMR Ambulance, from Intel, that has really helped us out a lot. But we feel very confident that that number is good right now. Now, we are still making phone calls and scavenging the internet all day long trying to find PPE. I know we have support from Dawn's group in helping us purchase that as well. And so that's something that we'll continue to do. And then finally, we have seen, and currently we have about a 20% reduction in our call volume. It's been anywhere from 20 to 30%, and it really started when we started the social distancing is when we noticed that drop off. This is good for us from a response perspective, because if we do open up the city again, if we do open up all of our bars and restaurants, and we do get that spike in cases, we will have some capacity to treat those patients. We were probably already in a good spot anyways to take on a spike, but this positions us even better. And then finally, the other great thing about the decrease, what I believe is the decrease of the service calls, is when you cut out 2 to 3 out of every 10 calls, that's 2 to 3 times you're not burning PPE. So it's really helped us stretch our PPE stock because we have less calls within the system. Okay, with that, I'd be happy to answer any questions.
Councilmember Wong.
I'm a little bit troubled with the reopening things. It looks like we do need to reopen it. We do. But I was hoping before we reopening it, we have some kind of plan ready, more proactive, so we can prevent a spike. Instead of, okay, we open it and we expect a spike. I don't think that's very proactive. If there's some way we take some kind of measurement that we can prevent a spike.
We're going to get into a lot more specifics related to that a little further on, so we'll have lots of opportunities. As we lay that out, exactly what does that look like? So that's going to be part of this presentation.
Sure.
Thank you.
Thank you.
Mayor. So as we're doing a little cleaning here, Police Chief Sean Duggan, I know many of you have had questions, and we want to relay to the community what we've seen in terms of the different types of crime and those sorts of things as part of this pandemic. So, Chief.
All right, well, thank you. Good evening, Mayor and Council. Just a few updates, but overall, the police department is actually in very, very good shape. Early on in the pandemic, we spent a lot of time updating our continuity of operations plans, ensuring that we have the capacity to continue to provide exceptional service out in the community. And now we're just over a month into this, and what we've experienced in the police department as far as employee leave rates is very good news. Our leave rate is very normal, meaning the amount of people that have called in sick is steady and very similar to what we've experienced in the past. In fact, there have been a few weeks where the leave rate is actually better than it has been in the past. So that was a concern initially, but that has not played out yet. And as far as staffing, in fact, we actually have more officers out on the street today than we did pre-pandemic, because when we ceased the number of our programs, our community engagement programs, the schools closed, we repurposed all of those officers and brought them back to patrol. So there's actually more officers out on the street today than there was pre-COVID. Our calls for service, you put that chart up. Remember on March 11th, the governor declared a state of emergency, and we immediately started to see a decrease in overall calls for service. And what we've seen now for the last month is approximately 25% decrease from this time last year. So that's a dramatic impact that we've experienced. And some of that is driven by the officers' proactive work, which we've taken back. Essentially, traffic stops, subject stops, some of the things that officers would routinely do, we've asked them to really use their discretion so we can eliminate some of that discretionary contact with the citizens in order to avoid, in order to support social distancing. So some of that is reflected there. But when we look at actual crime, we've actually seen a decrease in some areas. We've seen on average now, this is about a month's worth of data, about a 30%, close to 30% reduction in residential burglaries, close to 40% reduction in aggravated assaults, and traffic collisions, no surprise, have gone down dramatically over this last month. But we have seen an increase in some crime areas, and the first one being domestic violence. So over the course of the last month, compared to this time last year, we've been averaging about a 22% increase for the last month in domestic violence. We've seen a large spike in vehicle thefts, and we've seen a large spike in burglary to vehicles, essentially someone breaking into cars. So we're monitoring the patterns, we're looking at it every day, we're deploying resources accordingly, and and every day we're shifting our personnel to help address some of these crime spikes. As far as supplies, as the chief said, we're in relatively good shape. We have received just an incredible amount of support from the community, from private citizens, the community groups, to business entities donating supplies to us, and we are just very, very grateful for them. So because of them, partly because of them, we're in a good position for the next few months at least.
Any questions for the chief? All right. Thank you, sir.
All right. Mayor and Council, I wanted to, at this point, run through the governor's executive orders that have impacted us as far as the city goes. And then in this section, at least, with, as the mayor laid out at the beginning, the questions for you all tonight in regards to some of the things you've asked about possibly opening of facilities and or your direction in regards to council meetings in the chambers as well as boards and commissions as we go into the month of May. So with that, Matt, I think is going to flip sides for me, so I appreciate that. Governor's executive order. So on March 20th, there was an executive order to close gyms, indoor fitness, and clubs, and of course that did impact us. March 23rd, essential government functions were defined, and it was really left pretty vague, and quite honestly, I would argue most city functions are essential. March 31st, the executive order on stay home, stay healthy, stay connected was issued. And then on April 4th, there was additional guidance in regards to the essential services. The March 31st executive order outlined those essential government functions that were to remain open, and we have done all of this by offering a number of things. So we have adjusted many of our functions to online. We've limited the number of persons and physical spaces that we have, and we've limited access to specific facilities or areas at the direction of the City Council. Residents were asked to limit their time away from home except to participate in essential activities, engage in outdoor exercise activities if physical distancing practices were used, and to use services or products provided by essential, or use of services or products provided by essential businesses. Additional guidance on April 4th was to close amenities at public parks that do not allow for recommended physical distancing or proper hygiene, such as basketball courts, splash pads, playgrounds, and public restrooms. Public parks were to remain open to the greatest extent possible. We were to close all of our communal pools at parks. However, these should be maintained under the current environmental and public health rules and guidelines that the county has for us. As far as status of city facilities, Mayor and Council closed through the end of April the Chandler Museum and Vision Gallery, the Center for the Arts and the Center for the Arts Gallery, the Chandler Public Libraries, our recreation centers, the Community Center, Environmental Education Center, Sedgwick Recreation Center, Tennis Center, and Tumbleweed Rec Center. The park restrooms were closed through April 30th. The Senior Center is closed, but we do continue to provide a lunch for the seniors and a drive-by operation. The buildings on Ryan Road, Armstrong Way, and Information Technology were closed, and Public Works and Development Services are now by appointment only. Those things that were closed until further notice, all park amenities, which include but are not limited to our playgrounds, basketball, volleyball, tennis, and pickleball courts, dog parks, skate and bike parks, archery range, ramadas, and standard places of gathering. The Chandler pools and aquatic centers were also closed. Unavailable until further notice is our development services customer service counter. These right now are being done by consultation on appointment only. Chandler Police and the fingerprinting services they provide there. Housing and Neighborhood Resources Lobby, our passport office, tax and license service counter, and the utility bill payment counter. The status of city services that we are promoting a use by online, phone, or email include Chandler Police non-emergency number, code enforcement, the non-contact concerns that we have in codes, construction inspections and building permits, contact Chandler form, the court cases and information, request an extension, continuance, or payment plan, file a police report, housing resources and updates, public records request, request a police record, tax and license applications and forms, and utility payments. The status of city events that we discussed with mayor and council included canceling through April 30th all performances at the Chandler Center for the Arts. We canceled, postponed, and rescheduled till the end of May special events conducted by the city on planned on city property, and canceled until further notice in-person programming by Recreation, Library, and Arts and Culture. So tonight, Mayor and Council, we're seeking direction regarding city facilities and closures, and based on a number of questions you have asked. The first being the facilities and service that were not covered under the governor's executive orders specifically. Mayor and Council, those include facilities, the Chandler Museum, the Vision Gallery, and the Tennis Center, and our amenities such as dog parks, skate and bike parks, the archery range, disc golf, tennis, and pickleball courts. And I'll stop there and ask for direction on those.
All right. I wonder if we can even leave that slide up as we're talking through, that would be helpful. So, Council, I know we had closed these. There's been conversation from several of us about what does it mean to open up Chandler. In conversations with the city manager, again, these are things not necessarily covered by the governor's order that we closed. So I guess conversations I'd like to have are what interest is there and what timeline is there in opening any of these facilities?
Mayor.
Councilmember Orlando, then Councilmember Stewart.
So before we go through this, do we still have the 6 feet and personal space, no more than 10 people and 50 people at a time?
So I believe not 50, but we would still, anything that we do, there is still the social distancing and being in groups less than 10, not 50. So those are the two.
Okay.
Yeah, those are the two things that regardless of what we would do, whether it's indoor or outdoor, we would still encourage participation in.
Mayor, if I might. Mayor, Councilmember Orlando, the things that we brought to you on this list were exactly those things that we felt like we could enforce social distancing around. So you'll notice things like library is not on this list.
Yeah.
So these are things we feel like we can accommodate.
But I'm not certain in a dog park, I think social distancing would be the call, not necessarily 10 people, because that's a pretty broad area, most of our dog parks. You could easily social distance if and when we decide to open those things, as opposed to just having a ticker at the gate saying only 10 people could be in here. Why don't we start with park amenities? Those might be easier. Council, what are your thoughts on dog parks? Councilmember Stewart, I'm sorry, you had a question or comment to start too.
You're kind of going through it, which I think is, if we take a common sense approach to this, we look at what's outdoors, right? We just heard from the health director that heat is our friend. There's things out, and unfortunately I saw a family that was in the middle of the park the other day on a really hot slide. I felt bad for the kids, and I saw a police officer, nicely, really, say, hey, just letting you know kind of what's going on. They talked for about 5 minutes. I was in the park for a different reason, but those things are kind of common sense especially it's going to be 100 degrees this week. So we really should consider like those outdoor activities where you can practice social distancing better than you can at a grocery store. Those are things we should be considering, especially like a farmer's market. I mean, I can't think of a better place to buy fruit versus a Walmart.
Okay, so Councilmember Lopez, you want to start this?
I agree. I think that for the park amenities along a lot of these, the 5 listed, the dog parks, the skates and bikes, the archery, disc and tennis and pickleball, the courts themselves, I can see these are easily social distanced. Again, outdoor activities that the heat and the sunlight will help prevent. So I think opening these back up, in my opinion, would be prudent at this time.
Other council thoughts on park amenities?
So,
Councilmember Orlando.
yeah, thanks, Mayor. I find it hard to believe that we could do social distancing at skate park and bike parks. Those are confined areas. The kids usually group. They usually try to show off on each other. That's having 3 kids that went to those parks and watching them. So I don't believe, and being the age as well, that that's a prudent thing to do at this time. Dog parks, I can envision that opening up because you're right, there is some spacing distance. Archery range, I don't know. I mean, usually it's a one or two people solo sport. Discus golf, again, you're getting back into the golf area where maybe you have two or three people challenging each other. But definitely tennis and pickleball, I just don't think we should open that up because again, that's a packed group. Not
The
so much
courts?
on a court, but
That's
it's
what
a
it's
group of individuals. You may have more than 10 people sharing two or three courts, so we're already violating that.
I would almost, two thoughts. First of all, I think with archery, we could easily achieve whatever distance we want to by where the targets are placed. So if it's every other spacing or whatever, so I agree with you on that one. With tennis, I think again, I would treat the court, not the entire area, as similar to a dog park in terms, I would look at that in terms of sizing like that rather than, and I think that you can achieve social distancing on a tennis court, individual tennis court with 2 or 4 people on there. And then again, encouraging social distancing is how I would look at that.
So would we encourage tennis lessons and pickleball lessons as well?
I don't think we're any conversation about opening the lesson aspect or the tennis, at this point, tennis center. Certainly, it would just be opening tennis courts as a recommendation. But other comments? Councilmember Roe Wong?
Thank you, Mayor. On the park amenities, clearly a strong warning about just a reminder to these folks that visit our facilities that they should practice some of these things. Skate and bike parks, I'm not sure exactly how you handle that with a slew of juveniles. We wouldn't necessarily permanently disable a skate park, but we might continue to
We're not putting sand
we
in
might
any of that.
we might take that we might go a little slow on the skate and bike parks, but the rest for me full on.
So Councilmember Wong?
I don't have any problem opening park amenities. We did go to Costco, Sam's Club, Walmart, and you see people there. As long as we practice social distancing, and I think the risk is probably pretty similar. But I do strongly recommend we put some kind of sign on it, kind of warn the people. Only the people, of course, we probably are not going to enforce it very well because, but well, we post the sign and people do want to open it, and we do allow people to go to park, Costco, Walmart, and all those stores. So why not open it? Yeah.
So I'm hearing strong sentiment of opening our sentiment. We'll leave it. Dog parks, archery range, disc golf. Is everyone in agreement with those 3? And I can come back to the other 2. Is there any dissident thought on any of those 3? I'm coming back to the
On
next
those
one.
3, I'm good.
Okay.
Dog parks, skate parks.
Well, no, dog parks, archery range, disc golf. Now let me pick up tennis and pickleball. Councilmember Orlando has some reservations. This again is a council decision, I realize. Council weigh in on those for me. Councilmember McClemens.
On these tennis and pickleball courts, we're just, because we're not talking about facilities, outdoors, right? But, I mean, the only 2 cents I have on it that I would be apprehensive about is you're sharing a ball. You're sweating all over and sharing a ball. But, I mean, I'm just putting that out there.
No, sorry.
So taking each one of these skate and bike parks, kids are going to congregate regardless. Having them in a skate park in 100 degrees or whatever it may be, and then looking at some of the data that we got earlier today as it relates to the number of cases between 0 and 19-year-old in the entire state of 7 million people is 214. I can guarantee you that kids under the age of 20 are out and about. I see it all the time. So for whatever reason, I think if we're looking at data and using data, it is safe for kids to be at a skate and bike park. And with tennis and pickleball courts, you make a good point with the balls. You know, we can micromanage people's behavior, but at some point, people have to make a decision to use the social distancing. I do it every single day because I don't want to get sick. And sometimes we cannot manage that down to that level, in my opinion, unless, you know, we decide to close our parks, and which I don't think we should be doing. So.
All right, so we're definite yes on dog parks, archery range, disc golf. I am hearing positive sentiment on tennis and pickleball courts.
Agreed. I think that it should be opened.
Okay,
I'm still a little weird about tennis and pickleball courts, so.
okay. You're good with the, if the council
I'm
says
good
yes.
with dog parks,
Yeah.
archery, and I'm still concerned about skate and bike parks, just
I'll get-
because.
I'm going to get back to that one.
Okay.
I'm still on tennis and pickleball. I'm good with that one too. So I'm hearing everybody but one with tennis and pickleball.
I would be open to maybe a 5-day delay as it relates to all these on the pickleball and tennis, or at least the pickleball since they're all together, but tennis open, pickleball later, with maybe a 3 to 5 day wait on that. So if we open up everything tomorrow, and then we wait 5 days and open up pickleball.
That's it. Let me catch that question next. We'll go back to there. Skate and bike parks. I'm hearing some reticence on the side. I'm hearing some, who cares on this? No, they're not saying who cares, but just believe, yeah. Council? If I need to count to 4, we'll get there, or 3, or either way, but yes, Councilmember Wright.
To be honest with you, I could support opening all of these. I mean, we're gonna put signage out, and we're going to have warnings for people. There is so much news right now about COVID. I don't know where you'd have to be living to not know some of these things. Councilman Wong is right. Huge numbers of people in department stores and Sam's Club, et cetera. I think you can play pickleball and tennis and do it in a safe manner. And so I don't know about staggered starts or whatever. I'm in support of opening these up.
So, okay, so before we talk timing, any other sentiments here?
So getting back to skate and bike parks, again, we got to keep it limited to 10 people. So how are we going to police that? Again, everything we do here, we're going to get phone calls.
Yeah.
There's 22 people at the skate park, council member, what are you going to do about it? And then I'm going to call Marcia or somebody and say, hey, Marcia, there's 22 people at the Snedeker skate park. And she's going to say, okay, council member, I'll get somebody out there. And then we find there's 12 or there's 8. And then he goes, the police officer or park ranger says, hey, so that's a child thing. Most of those kids are not adults. I mean, there's some spurs in there, but I really believe from a safety and a monitoring standpoint, skates and bike parks should stay closed because we just can't monitor it. And if you want to keep tennis and the other part, they're adults. Most of those are people who are adults that are playing that game. They could read signs and there'll be social distance.
Can we ask for clarity?
It's a tight area.
Ask for clarity. So again, on the edict, again, we're talking about these, again, skate and bike parks were never necessarily edicted by the governor saying they need to be closed.
That is correct.
Correct.
That's why we have them on this list.
And the other requirement, again, in general, saying, okay, we need to still make, if you're going to be doing any of these, any other amenities or any other activities, social distancing, and the 10 people thing, was that 10 people at an event, 10 people at a location, 10 people within 50 feet of each other? What, was there any requirement, or it just said no events of 10 people?
Groups of.
Groups of.
Yeah.
We'd have the chief
So-
come up, but it looks like he stepped out. But CDC guidelines, if I remember correctly, were 10 people, no more than 10 congregating. But beyond that, there was not like 10 here, 10 there, any of that. It was just, and again, it's CDC guidelines.
I personally still don't see it. I mean, yeah, kids will congregate there, but I still, you don't see 10 of them together. Every time I've gone there, it's been 3s and 4s in groups, in different groups. But again, I have no issue with opening them up. fully, all of them.
Okay. All right. And we, actually lean closer to you on this one, Councilmember Orlando. Strange.
No, it's not strange.
But I think if we could put up some good signage, you were right, we are going to get phone calls. And if we see a lot of misuse on this, I think we can always turn around and shut them again if we need to. This is, so.
Mayor.
Councilmember Rowe.
Yeah, so another, I'm a little fickle sometimes, but because Councilmember Stewart did talk about staged openings and that sort of thing. So I think the main thing anybody has any contention with is the skate and bike parks. If you want to put a 2-week delay on those and see how the rest of our openings go, that's a possibility too. And
Okay.
and just see how, I think that people are going to call and say, someone's playing pickleball, and our response should be, isn't it great? Because people are living, and so I do want people to get outside. I do want them to have a life. People have been trapped in their homes, and so we need to be optimistic. We've got to go forward, and so that's my thought. Thanks.
Where I often find pickleball players congregating is more outside waiting to go in. And, but again, we can encourage social distancing in those lines, and if it's chalk marks or whatever, I mean, we could do that there. So let me now talk about times. Let's start with skate and bike parks. I'd like to suggest the end of April for that one and open the other ones earlier. Can we get some consensus on that? And if we need to revisit that, we can?
So you're saying, Mayor, that we open everything except skate and bike parks maybe this Friday, and then skate and bike parks at the 30th?
I'm just walking it back right now. That's what my recommendation is. Skate and bike parks open the end of the month, as did everything else. And if we want to open these other things tomorrow or Monday or whatever, that would be
So
my
I would-
second recommendation.
Yeah, my recommendation would be open everything this weekend, but since there's some skate and bike park questions, I'm good with waiting for another week. It's
Okay.
23rd now, so in a week, it's next Thursday, it's 30th.
Councilmember
so-
Stewart.
Mayor, my recommendation is open everything tomorrow, except for possibly pickleball courts. It's an older sport, and that seems to be, if we're using data, seems to be where the challenges are.
So pickleball is indoor.
This is only outdoor that we're talking
These are
about.
all outdoors.
Yes.
So I would recommend we open as soon as possible if when the staff are ready for those signs and everything.
Okay.
Yeah.
So I am hearing most council members say, open things as soon as possible. There's some nuances of differences on here, but, so let me ask, how many dog parks open tomorrow?
Is that possible? We don't need any preparation or no?
It's as soon as feasibly possible.
Okay, let's put it that way, as soon as feasibly possible.
They'll figure that out.
Skate and bike parks? Okay, we're hearing delay on that one, good. Archery range as soon as possible, disc golf as soon as possible, tennis as soon as possible, pickleball courts. As soon as possible? As soon as possible?
Yeah.
All right, as soon as possible. Indoor facilities, Chandler Museum, Vision Gallery, Tennis Center.
Mayor, I'm sorry to interrupt you, but before you leave that, I just want to make sure, as far as skate and bike parks, you said a week. Are you saying May 1st, if we're ready, open skate and bike parks?
Sure.
That's just a week and
Yeah.
after April 30th? Okay.
City Manager, what does soon as possible look like to you?
On which one, Mayor? I'm sorry.
On the other ones?
On facilities?
No, on the.
Oh,
park
on the other
amenities.
ones? I know we've already ordered signage, and so as soon as we get that signage, we will be opening. So probably over the weekend or first part of next week
Okay.
would be my guess. And Andy's back here.
We have the signs. Good evening, Mayor and Council. We do have the signs. We got them today. And so we'll start this tomorrow morning with our staff, and the goal will be to try to get it done tomorrow.
Okay. All right.
Thank you.
Andy, be sure and wipe up. Neil.
I think we may have
You're
it.
good. Yes, I did. All right, facilities. Museum, Vision Gallery, Tennis Center.
Mayor,
Councilmember Huang,
I understand these are all indoor,
correct?
and when the temperature going up, there will be AC. It will be circulating, and I do not have the medical expertise to know will that make everybody sick or not. But if that's not an issue, I think we can also open it. But we may want to follow the guidelines, maybe 10 people at a time in one room or whatever. But they are, because these are the locations we can control the people, the number of people. Outdoor, it's very difficult to enforce, but indoor, we can control it. So, yeah, that's my comment.
So your comment is as soon as possible, but control the numbers
Yes.
going in, and again, have people exercise social distance. Councilmember Lopez,
But
Vice Mayor Lopez.
Thank you, Mayor. With this one, my original thought is to maybe wait a week still again, to wait for these 100-degree temperatures to kick in a little more, a little warmer, a little drier, and then opening up, because again, the CDC rules still apply, no congregating, try to maintain 6 feet away, no grouping together of 10 and more. And unfortunately, I don't think we get an extreme crowd at the Vision Gallery often. And at the Chandler Museum, it's picking up definitely, but again, with the posted signs and the staff to be able to remind people to please not congregate. And I could see personally all those three opening up at the end of the month, 1st of May or whatever, for those. So that's my opinion.
Other input? Councilmember Rowe.
Thank you, Mayor. On facilities, I just had one question about the tennis center. I'm just wondering about how that could be operated. Can we do that in a way that staff can deal with that? And
So we would propose reopening it as we were operating before we closed it, which basically there's a side gate that we opened it up. There's no reservations. It's first come, first serve. And we do have staff on site who can help make sure social distancing is happening. But it's kind of just a first come, first serve to use the courts at that time.
thank you. Mayor, I'm in favor of
Mayor.
opening up.
While Andy's still here. So the tennis center really is the courts, and this is outside. We're not really talking inside.
No, we're not talking about the clubhouse.
Yeah, okay. So this really is akin to other tennis courts. This is just the center at Arrowhead, outside.
Right. It's all,
Okay.
yeah, tumbleweed.
At Tumbleweed, and we can regulate that because we have staff there anyway, is what you're saying.
Yeah, and it was operating before we closed it, and it seemed to be going fairly well in terms of social distancing and people being respectful of distances. So.
Okay. Councilmember McClimans.
So I know this will probably be addressed later, but when we discussed the plan about opening the city, and just really it falls into these questions right here. If we're having staff that's public facing, do we have a plan in place as far as staff wearing masks? That is part of the plan, correct. Okay. Yes.
So tennis center outside, I'm hearing opened and alongside with park amenities? We all good with that? How about the two indoor facilities, museum, Vision Gallery? Council Vice Mayor Lopez suggestion is beginning of May. Council, what's your? Councilmember Orlando.
I'm going to go back to the facts and figures we keep going back to and still say we're still not meeting these objectives that both the federal government and the state government is beating down. And I'm concerned opening these enclosed facilities. I really believe we need to be patient on those and anything enclosed and just wait for those guidelines or those metrics that we're talking about. We spent a good 2.5 hours talking about all those metrics, and we want to open up an indoor facility, which only 10 people go into. It doesn't make sense to even open it up. If only 10 people go in at a time. So that's, to me, I don't know what the hurry is. You want to do the outdoor stuff? Again, there's some rules and guidelines. We discussed that already, but indoor stuff, I just don't know why the rush. We haven't met those metrics.
Yeah, I don't think there is a rush. There is just, this is a conversation of things that, again, are not covered, that the city believes that we have the capacity to open. But that's why we're having this conversation today.
So my suggestion was wait a couple more weeks on that and revisit it. Once we get some information from the governor and some of his activity, what he thinks he wants to do, and we could use that for some guidelines as well.
I'm going to just swing this way. So, Councilmember Rowe.
So I've been to all three of those facilities, and I don't think we have any attendance issues that would really cause a concern. And so for me, I think we should go ahead and open.
I agree with that. We can just open it, but there's some precaution we do need to take about the 10 people gathering. We need to define it. Is that one room for 10 people or the whole building 10 people? So I think we do need to define it. And personally, I believe it would be one location, 10 people. For example, one room, 10 people. And so we can put as many people as possible, but we limit on 10 people in the same location. So, yeah.
Mayor. As
yes,
y'all are
City Manager.
discussing that on those two facilities, I know there is concern over having too many people inside. What we would propose, and Kim's here, is timed entry. And so to only allow so many people in, and then those people have to be gone on a certain amount of time before the next group's allowed in, and we would have to do some wipe downs if necessary in these places in between.
One more. Yeah, sorry. Also, I would like to encourage the staff to wear a mask. Or we cannot tell people to wear masks, but if our staff wear masks, then it sends a message that you can protect yourself or protect other people wearing masks when you come to this indoor facility.
Make them available.
Yeah, okay, yeah.
Mayor, working with McClymonds and then Stewart.
The only thought process is, Governor Ducey's order, stay home, stay healthy, stay connected. And the outdoor facilities provide for great opportunities to social distance, but they provide the opportunity to stay healthy, which is mission critical, when people are confined to get out of the house. I don't feel like the Vision Gallery, the museum, is a mission critical operation. And, indoor tennis either. And so I don't feel a big rush on those activities or those facilities to open up. I'd be comfortable waiting on the official order and align those with the phase one whenever that occurs. That's my position.
Councilmember Stewart.
I think the term mission critical is important. The term mission critical is important. I think, it's what you're alluding to there. And yeah, I think we'll get it figured out. I'm not going to waste any time.
So I'm hearing, council, let's wait on opening the two facilities, the museum and the Vision Gallery. We can revisit that at another time. But I'm also hearing lining that up with the governor's opening of phase one. Is that correct?
I want to collect that one thought. If there is no directive and there is no recommendation from there is a recommendation, but there's no mandate for masks. Well, I'm not going to force. If an employee needs the mask and wants the mask, they will provide that, but we're not going to mandate that for conditions of employment.
Yeah. Councilmember Wong.
State do not provide the tennis court service. They have some museum, but they do not provide the tennis court service and the other one. So I don't think we need to wait for the state to tell us what to do. We can basically make that decision ourselves.
I think we just did already on tennis courts. We're good with that one opening. All right, so we've got direction on all of those things. Let's proceed. So we're waiting, we'll convene again on the 2 indoor facilities and opening all the rest of them.
What did we decide about the vision gallery?
We are going to wait on those 2 to line up with either this council decides that it is good to open or lining up with the governor's opening of phase 1 if he's following the president's admonition. So, and we're also delaying on the skate park. Did we say until the
May
first?
1st.
Okay, yeah. And everything else as soon as possible. All right, let's keep going.
Turn it off. All right.
We have 2 more hours left. Is that what we got?
Somewhere close.
Okay.
So Mayor and Council, next, the council chambers and meetings. So I just want to let you know that we do have a couple of public hearings coming in the next month and a half. So I just want to make sure that you all are aware of those, and then we've got a couple of options on the council chambers in your meetings. You have already stated you want to continue with your May meetings in the fashion you've already approved, but I want to give you 2 options. Option number 1 on the council chambers would to keep in place what you have now, which is closed to in-person public attendance with the online comment card that is provided to the city clerk prior to the meeting. And then option 2 is around reopening the chambers here for public attendance at public meetings, limit it to 50 people in the audience. Obviously, we would have some work to do to lay that out. Install appropriate social distancing signage and markers, install the temporary markers on the seats or floor to designate which seats could be used, providing the disinfectant and wipe downs for the podium, and then use any overflow measures we currently have outside in the lobby and then outside in the courtyard, because we do have the ability to broadcast that out there and then bring people in individually. I only ask this because, again, we have a couple of public hearings coming. The first one of which is the public hearing on the annexation for the new Chandler High School for Chandler Unified School District, should be some point in May, and then followed later with your budget public hearing. So wanted to at least lay out a couple of options and get council direction how you want to handle the May meetings.
So option 1 is continuing as is, but realizing when we have public hearings that it's a little more awkward and difficult for us to have a true public hearing for with a sequestered median. Council, what are your thoughts? Why don't we start this side and work this way again? So, Councilmember Stewart. It's what we're doing right now. People
So
make
can I look at
comment
option
cards.
2? So this is 14, 16 people, 14? We're talking about 50? That's a big difference. But I think people have the right to address their governors, or whatever you want to call it.
Governance.
Governance, thank you. And so we had an option today for somebody to do that, right? We should provide options for people, and we can work through that, and we can have people call in and say, I'd like to address governance in person and allow for that option. But I think for at least another 2 weeks, we should continue this method for the safety of our staff primarily, especially when we have our meetings. And I think we can do things remotely, and we're figuring out how to do that electronically, and we're a city of innovation, and we'll figure out how to do that even better.
So what I heard you say was for the next meeting, use our current system, but opening up, if there is someone who, there's a direct case to allow them to come in, what about the second meeting in May? To be decided?
We can decide at that meeting,
Okay.
that next meeting.
Councilmember McClemens. Uh-oh. It's 10 o'clock somewhere.
I've heard about these meetings.
Yeah.
I'm of the thought process, 2 to 4 weeks. We will make special accommodations if we feel like there's a scenario where the public needs to interact like we did tonight. But I'd be open to his plan, wait a couple weeks, but, or May, and function the way we are currently.
Okay, because May is our next meeting, yeah. All right. Vice Mayor Lopez, sorry to keep calling you council member tonight.
So are we able to accommodate a 2.5 where it is public meeting, 50 people, but yet people can still do electronic notices and all of that still?
Yes.
And the conversation is still not allowing casual observers to come in, but if people would like to make comments, or what's the difference here? So if Jane Citizen just decides that she wants to come to a council meeting but has no reason, is she one of the 50? Or is she told that, I'm sorry, only speakers get to come in? Or commenters? Clarify for me, please.
Mayor, council, I would assume that would be on a first come, first served basis. I don't know how we would
Sure,
necessarily
okay.
enforce that if we're talking about 50 people.
All right. So I'm hearing these three say for the first meeting as is and to be decided on the second. Did I hear that correctly?
That's fine. I was, as is for the first meeting, but I was saying we open on the second. I mean, we can see what the numbers look like then, but I'm good with that.
Okay. This side.
You know where I stand.
Okay.
Good. Keep it the way it is.
My turn?
Great.
Or-
Yeah, let's go this way. Go
Okay.
ahead, Sam.
So I think I agree with Councilmember Stewart's recommendation. We can kind of combine, we allow the online meeting and we don't encourage people to come here, but for the people who want to speak out, who are willing to fill out the speaker card, we should allow them to come to the chamber to speak.
Okay.
Yeah.
Councilmember Rowe.
Thank you, Mayor. This is, I don't think we're scheduled to get together until the 11th of May, so there's a couple of weeks there. I think we should go with Plan B or the second plan, and if we've got some staff that can monitor how many people are trying to come in, we rarely see this house fill up. I think we can manage it, but, anyway, I have no objection to them doing that. There's a plan, so it sounds like we could carry that out. If some numbers changed dramatically in the next 2 weeks, we might say no to that. But I would say let's let staff decide, and we'll see who shows up. That's my.
All right, so you're an against the tide person. Councilmember Orlando.
You know, I agree with that side of the aisle.
All right. So
Well,
consensus
just real
is
quick,
that.
Mayor, I have a question for staff. Is there a way to get real-time questions to this council during these hearings? I mean, do we have somebody monitoring the internet?
Well, we don't take
We
real-time
can't.
questions
Just figure it out.
now.
Well, I mean, if you have somebody that has a case or something, or
Okay.
an unscheduled public appearance, they could fill out, instead of waiting for 5 o'clock the day of, if they have a question.
Yeah. So we have that capacity now for people to do unscheduled public appearances, to have that either given to us or read to us now. And we've
So my-
tried to enhance that, but
So let me clarify my question. We have a case come in here, and there's someone in the audience that, listening to the case, comes up here, normally would give a card to the clerk and say, I want to speak on this issue. Do we have an ability to do that? Like tonight, on the liquor license thing, good example. We had someone in the audience says, hey, I got an idea or question. I give it to her and check it. I can participate in this thing.
So, Mayor, Councilmember Orlando, we do have an online comment form, goes on our website, so whenever someone submits that, it gets submitted into our system. I'll ask the city attorney to weigh in terms of using social media platforms. That's a different issue because we have to also comply with open meeting laws, and having an open platform like that where people can comment, they can also have an influence on all of you in terms of the dialogue. So we have to meet the open meeting law criteria. But we do have an online comment form, and so whenever someone submits that, we have a process right now with the clerk. Any comment forms that are submitted before 5 are provided to you. Any comments that come in after 5 are provided by the clerk, and she will read those off as part of the minutes.
Okay, so so you do have, you're monitoring that during the council meetings as well?
Councilmember Orlando, yes. Actually, if they come in through, it gets sent to an email and I can read them on.
Got it.
my phone,
Okay,
so.
great.
So we have that capacity.
Perfect. Thank you.
So I think the consensus was, again, for the first meeting, continue to use what we're doing and then potentially opening this up for the second meeting. Correct?
Yep.
All right, keep moving. No, the second one in May. We're having 2 meetings in May. Correct, the end of May. Council member.
Yeah. My understanding is we continue use the first option, but we allow the people who want to speak to come to here.
No, for the first meeting, they will continue to fill out an online piece.
Okay.
Unless they have a case similar to
Yes,
what we've
like
got
today,
going here.
yes.
Yeah, we would do that if someone's, yes, if there was actual dialogue back and forth
Yes.
rather than just recording a message. All right, next.
All right, Mayor and Council, boards and commissions. So your boards and commissions have been on hiatus for the month of April, but we do have a few that we've got some business that we need to get in front of those boards and commissions for May. So laid out a couple of options, again, open to whatever suggestion council wants to make. Option 1 would be to allow virtual meetings of those boards and commissions for the month of May, for the ones that have business needs. And then also provide an online comment form that could be submitted to the board liaison prior to the meeting and read into the record if that is necessary for whatever's on the agenda. The second option would be to resume meetings in person with limited attendance and then continue with the online comment card. We would have to make sure those meetings were held in conference rooms that would accommodate the social distancing.
So in essence, choice 1 is like a Zoom meeting. Choice 2 is similar to what we are doing tonight. Let's go this way. Start with you, Councilmember Orlando.
I guess I'm okay with, well, I'm trying to figure out where do you want to hold these meetings that you said with the room? Would it be like in the chamber here?
Could be the chambers, council member, or it could be our double training room on the second floor. We have copper room at the library. We've got the community center at the police department. We've got
Okay, so
a
there's
number of
large enough
places that
rooms.
we could really spread those out.
So what are the boards and commission you're looking at? You said that needs to meet.
I don't know if I have a total list, but definitely planning and zoning is continuing to meet in here. I know Leah's got Human Services Commission or human that needs to meet in order to move forward with some federal grant funding. Some of those boards and commissions like that. Parks may need to meet, transportation may need to meet, and there's a host that may need to meet, but only if they have business needs. I will tell you that some of them like to meet. Those we would put off, the liaisons would put those off until later. But if we actually have business that needs to go through them in order to get to you, those are the ones that we would recommend moving forward with somewhat.
Yeah, again, I would probably look at a room. I'm okay with a room, Mayor, but limiting the scope of the people coming in there, again, I just don't want.
So you're saying B?
Yeah,
All right.
but limit the scope. Make sure there's only, they need to be there.
Councilmember Rowe, A or B?
Thank you, Mayor. Sorry to not give you, I know you want A or B, but I just had one question.
I don't have a preference on this. So.
Yeah, I understand that. If you have a board meeting and you have the X number of people, any member could elect to call in.
That would be correct if that is the guidance of the council.
That would be my choice.
Okay. So yours would be B with call-in potential. All right.
Availability, yes.
Councilmember Wong, A or B?
I don't have preference.
Okay. All right.
I do want to explore the possibility like how we see in the movie, like everybody have a computer in front of them and with a camera, right? It looks like Zoom are doing that, right?
So you're preferring choice 1?
Okay, yeah.
Okay.
Maybe with 2 with the option to call in.
2 option to call in?
2 option to call in.
2 option to call in with the Zoom maybe too.
Well, I have a story to
All right, let's go with 2 with the option to call in. That was easy. Wow. Next.
All right. All right, well, we're going to round out the evening tonight with the next piece. So, Mayor and Council, I just want to reiterate that as of tonight, as you know, the governor has been silent on his plans for reopening the state's economy, with the exception of the executive order that was issued yesterday to allow hospitals and other health facilities to begin opening on May 1st. So the presentation you're going to hear next is in line with the president's guidelines for opening up America again. Once the governor and then you as a council give the go-ahead at a future meeting, we will adjust this plan accordingly and proceed. Tonight's briefing is to make sure both City Council and the community knows that the City of Chandler is ready to reopen and we have a plan to do so. I will ask Chief Dwiggins to come back up and begin the last part of this presentation.
The beginning of the end.
Did Matt wipe it down?
Thank you again, Mayor and Council. So I'm going to just go over the three-phase approach. As you guys know, we already went over the gating criteria. So we're going to go specifically into each phase. But as I said earlier, while you're in this phase, it's a 14-day phase. And while you're doing the phase process, you're also doing the gating criteria process. So it's very important that we continue to watch that data. So starting with phase one, and the way that these phases were broken up into was guidance for individuals, guidance for employers, and then guidance for specific employers. And we're going to really focus on, because there is a lot of them, guidance for individuals and for specific employers. So a couple of things listed in phase one. One is that you maximize physical distancing when in public. Another one is that you avoid socializing in groups of more than 10 people. So that's an important number right now, 10 for phase one, because that's going to change in phase two. Schools will remain closed, and that includes organized youth activities. Senior living facilities have all visits prohibited. Large venues operate under strict physical distancing protocols. Again, the key word is strict on that one, because that will change in phase two. Elective surgeries, we've already taken care of. Gyms will operate under strict physical distancing and sanitation protocols. Again, the key word is strict. And then bars remain closed. So as you go through that, you get through the 2 weeks, you pass into phase two. And now when we're in phase two, we are going to avoid socializing in groups of more than 50 people. So obviously from phase one to phase two, we went from avoiding groups of 10 to groups of 50, I apologize. And one thing that's important about that language is you need to avoid those groups if you cannot socially distance. So if you had a big enough facility where you could still maintain social distancing, you could, according to this, go above that threshold. Schools can reopen, and so can organized youth activities in phase two. Senior living facilities, those visits are still prohibited. Large venues in phase one had to operate under strict physical distancing protocols. Now they move to moderate physical distancing protocols. Gyms can operate, they stay the same as phase one, so they operate under strict physical distancing and sanitation protocols. And then in phase two, bars can open back up, but they have to operate with diminished standing room occupancy where applicable. So again, we go through our 2 weeks, we meet the gating criteria, and then we enter into phase three. Phase three, as far as the individuals goes, this is the first phase. I didn't want to touch it. I don't want to have to clean everything. This is the first phase where, and I didn't say it on phase one and two, where they're actually allowing vulnerable individuals to not shelter in place. So in phase three, vulnerable individuals can resume public interactions. However, they are asking that they remain social distancing in phase three. Low-risk populations, and I believe that is us, should minimize time in crowded environments. That's in phase three. As far as specific employer guidance, senior living facilities, visits can resume. However, there's still strict guidelines on sanitation, on how you're going to track people coming in, how you're going to check their temperatures, all of those things. Large venues, remember in phase one, it was strict physical distancing. Phase two was moderate. In phase three, you're able to operate under limited physical distancing protocols. In phase three, gyms can open. Now they no longer have to have any type of social distancing, but they do have to have standard sanitation protocols. And then finally, in phase three, bars can operate with increased standing room only. So there's more to it, and there's more to it on the employer guidance. But as you can see, there's a lot of words in there that are really open for interpretation. And I don't know if I would assume that there's going to be some type of follow-up or guidance on what a lot of those things. But it is certainly a phasing process in which, as long as you meet that criteria, it continues to open up or increase the numbers of people that can come together. So,
to interrupt you. Before you start into our return to service plan, I just wanted to make sure, and this may answer some questions for council, it might help speed through this bit. We do have support departments that are going to be instrumental in being able to get the forward-facing departments open. I know I've heard already from council a number of discussions around masks and things like that. Our masks that we have are going to be geared for our public safety personnel that are forward-facing and our forward-facing counters as we go forward. We do not have a supply chain to provide everyone in the city with a mask. So I just want to make sure that's very clear so we don't have that question maybe come up several times as we go into the return to service plan. Also want to mention that as part of this, we have built this again around the 3 phases of the federal government. If the governor comes out with something different, all of this will need to be modified, and will be, if it's major modifications, we'll definitely be bringing that back to council. So with that, Chief.
okay, so to the city manager's point, we did, and I can tell you that we opened the EOC early March, first week, and our main goal was to start to establish the COVID-19 response plan. That was, I mean, there's only a few cases in Arizona. And it probably wasn't 2 weeks later that we expanded the EOC and really involved all of our director team, everybody in this room. And it probably wasn't 3 days later that the city manager gave us one of our first objectives, which was to create this plan. And so this return to normal operations plan is something that we've actually been working on for quite some time. We've submitted a couple of versions to the city manager. We've received those back to get more into the details, but it is a very comprehensive plan where a lot of work has been put into it. I can tell you to the city manager's point, one of the, just looking at the plan and all the things that have to happen, I think one of the biggest challenges for all of us is going to be logistics, and it is going to be a supply chain issue. I know Mike Hollingsworth is in the back right now, and he was on a call today. He's part of our logistics team. They are identifying every department and division within the city. They're looking at this plan, and they're trying to understand what the needs are going to be. We track PPE, but we know that as we open up operations, our current burn rate that we see today is going to increase. The amount of cleaning supplies, I mean, right now, everybody that comes up here is using one of these towels, where we might only use one in an hour, we're using 5 or 6 now in an hour. So we're really trying to understand what that looks like, and we're trying to think long-term, not just 3 phases, but where are we in the fall if there is a flu bug that comes out and there's a resurgence of this virus. And so it is a very comprehensive plan, and it's a living document that will continue to grow. So with that said, I'll start out with the fire department, and then I think all of the directors will come up here and speak to their specific area. With the fire department, it's a little bit more simple for us because we really haven't shut down too much. All of our operational crews are still in operation at all 11 fire stations. I can tell you that there's not a whole lot of changes that we're going to see. There is no vaccine for this virus. There is no herd immunity to it, and we are still responding to nursing homes. And even when this slows down, one of our biggest responses that we have are to these care facilities and this vulnerable population. So we're going to have to continue probably well into December, maybe into next year, to utilize PPE to make sure that we're not cross-contaminating our firefighters or tracking things into these nursing homes. So our operations will continue as they are. I can tell you that the two outward facing areas that may change, one is our school programs. Obviously, the schools are shut down right now. And even though we have 3 phases here, we just don't think it's safe yet for us to go to the nurseries, to some of these, the Girl Scouts or Boy Scout events, just because we are still responding on calls. Now, we do believe that Arizona Department of Health Services, CDC, Public Health, they're also going to put a plan in place and guidelines in place for paramedics and first responders on how we should move forward. The one area that we do feel that we can start to open up is our fire prevention team. Phase 1, we elected not to do anything. We understand that during phase 1, a lot of our businesses are going to be trying to figure out what this looks like, what the new norm looks like, whether it's a bar, whether it's a restaurant, a regular business. And probably the last thing that they want to see is a fire inspector showing up and going through all of their fire systems. And so we are empathetic to that. We have moved our opening for fire prevention into phase 2, and that is for our normal business inspections and our follow-up inspections. I will let each of you know, though, we have talked in depth about this with our fire prevention team, and everybody is on board right now in the understanding that the likelihood of some of these businesses changing their operations, whether it's the layout of their building, the way they deliver the service, may come up against the fire code. And our goal is not to present a challenge to these businesses. Our goal is to be the solution. So we will be advocating for businesses. We will be extremely proactive. We will work with them to do whatever we can do to make sure that they're operational and that they can start to bring their business up. The last part of phase 3, really for us on our fire prevention team, is resuming inspections in the care facilities. Right now, that is on hold by the state of Arizona. They do not expect us to go in there, nor do they want us to. But as soon as that opens up, we will start to put a plan in place. Obviously, we are going to have to wear PPE on these inspections. We're going to have to figure out the right way to do it so that we minimize exposure to both our inspectors and the staff and the patients in these facilities. So that's what we have for the fire department. As I said, we're probably a lot more long range just because we still have the active virus, but it is something that we are working on every day. Happy to answer any questions about our phasing plan.
Right, thank you.
Gotcha. Let me turn this in.
There we go. All right, just real briefly from the police department, our operations and what the community sees out on the street essentially has not changed. So we have the same level of services we're providing now than we did pre-COVID out on the street. So phase 1 and 2, there'd be no change. But the one area that has been altered because of the pandemic is our level of community engagement and our outreach initiatives. So from our ride-alongs to our Citizen Academy, our Guardian Academy, and programs like that have all been postponed. So when we enter phase 3, we'll be able to stand up those programs once again.
Council Vice Mayor Lopez.
So in phase 2, schools open up, is that correct?
Phase 2, schools open.
So the SROs then would also return to
Yes.
the schools, though? They would still do that? Okay. Thank you.
Any other comments or questions? Councilmember Huang.
This is not directly related to the PD. We have mentioned about sanitizing and all those PPEs, but there's one tool we didn't mention is the thermometer. We know one symptom for COVID-19 is fever. So this question is also for our city attorney. Are we allowed to test people when they want to come in our indoor facilities? their temperature. If they have fever, are we able to say, sorry, you cannot be admitted?
If I may, Mayor, Councilmember Wong, that is a tricky issue because you're asking staff that may not be trained, they're not medical experts, there are different reasons. It could be considered going after their medical standing. So if we were inclined to do that, I'd have to look at it very carefully because I think there's a lot of legal liability that we'd be exposed to.
So I mentioned that because this is widely practiced in almost every school, in airport, in indoor facility, all the public area in Taiwan and in China. So and those people are not really medical trained, and those thermometer is pretty easy to use. I just don't know how intrusive it is. Yeah, so.
It is in the U.S. with our liability laws and our privacy laws, it may be more challenging for us to do that.
Yes, but if I do know in the school, if you notice a student have fever, you normally will call the parents and ask the parent to come to school to pick him or her home, right? So if we apply the same philosophy, we probably can do it. We do not want to have somebody with fever to come into the facility. Now, I just want to make a recommendation for our staff to consider maybe you can include it into our plan for reopening. Yeah.
Can I alter that to say staff look into that? Because I think that would be, rather than a council member, something that we might want to discuss as a whole. But if you'd want to look into that and just see what that looks like, or is that a best practice around the land in other cities, that's what I would recommend. Okay.
Yeah, thank you.
Anything else for Chief Duggan? All right.
Don.
Mayor and Council, page down here. In management services, it's kind of been business as usual. We are internally servicing all of our departments in the city, but we do have a couple customer-facing areas, and that is utility services and tax and license walk-in counter. And the approach we're taking here is we're trying to stay in alignment with our other counters in the city. So that would be development services, city clerk, and making sure that we're all doing the same approach here. So in phase one, we're going to continue to keep the counter closed to walk-in services, but we're going to look at implementing during that time safety measures, plexiglass partitions, floor markings, and so on, and identifying and developing an appointment scheduling software. This is something our IT department has offered to work with various departments and put in place, that if we do have folks that would like to meet and consult face-to-face with some of our experts in both the tax and utility area, we're going to give them that option to make an appointment online. So we'll use that phase one period to get that developed and set up. By phase two, we would like to actually provide that ability to make appointments for customer consultations and continue to provide or promote business online by email and phone, which has been working very, very well in the meantime. During phase three, the counters, we do anticipate opening up the counters for walk-in services with those safety measures implemented, continuing to offer by appointment consultations for those that may still be a little hesitant to come into the public counter, and continue to promote conducting business online as well. Any questions?
Thank you. Good plan.
Great. John?
Thank you, Mayor and Council. Public Works and Utilities have essentially been unaffected by the COVID issue. We've been moving ahead with all of our normal services, with the exception of household hazardous waste. A few weeks ago, we stopped taking the scheduling, the appointments for that service. We do intend to probably bring that back up in phase 2, as long as proper PPE is available for our staff. When you do collect household hazardous waste, you're supposed to wear the gowns and the goggles and the gloves. So as long as those are available, we'll probably bring that back up in phase 2. Only 2 other things have changed in the utility, really. We did pull back from doing the residential water conservation audits that our staff has done for folks when they have an irrigation leak or something like that. So probably in phase 3, we'll move back to that. And then finally, our streets and traffic groups, we've pulled back a lot of our maintenance practices out of the residential neighborhoods during this time. And we've been concentrating on the arterials and collectors. So when phase 3 comes, we'll probably move back into the residential areas to do paving and the ADA work and the sidewalk repairs. We still go into the residential neighborhoods when there is an issue of some severity, but we're trying to stay out of the neighborhoods at this time. So phase 3 would be the time we move back in, but that's about all the changes for us. Any questions?
Councilmember Stewart.
Thank you. Real quick, did you say that you were moving some of the road maintenance work on our major streets and arteries to this downtime now and kind of rotating that stuff around?
Exactly,
Oh, that's
Councilmember
brilliant.
Stewart.
Thank you.
What we've done in particular, our supervisor came up with the idea of taking advantage of the time when the schools were out to actually get in front of some of those schools and take care of the paving issues that we've had. So the staff has worked really well to get out ahead of some of those things in the downtimes.
That's great. Way to be nimble.
Thank
Derek?
Hey, good evening, Mayor and Council. Development Services remains almost fully operational during the COVID-19 crisis. Because we're constantly adding to and promoting digital services, we're well positioned to keep operations going. Our development partners are also nearly all digital. We are still processing zoning cases, reviewing plans, issuing construction permits, and conducting inspections. We did need to reduce services for walk-in customers, to reduce it to pick up and drop off only, and we eventually closed the lobby in our building to public access. So to begin, for our phase 1 return to service, it's very similar to what Don went through a few minutes ago. We'll keep the counter closed to walk-in service, and we'll work on implementing safety measures. For example, installing plexiglass partitions, floor markings, and making sure we have the right PPE and sanitizing products. We're also working with IT to install the appointment scheduling software that Don mentioned. We would reopen the lobby and establish pickup and drop-off service in the lobby only with no direct customer contact. Or phase 2, we continue to make appointments for customer consultation that would in the past have been walk-in, and also continue to promote conducting business online and by email and phone. For phase 3, we would reopen the counter to walk-in services with the safety measures implemented, continue to offer by appointment consultations, and still encourage conducting business online and by email and phone. And that is our return to service plan. Are there any questions?
Thank you.
Dana?
Mayor Harkey, members of the council. In the city clerk's office, the only external service we suspended was the passport acceptance program. As you know, the United States Department of State is in charge of the passport acceptance facility program. They set all the rules and the guidelines, and they make sure a passport facility such as ours meets those qualifications in order to be certified to run their program. So over the past several weeks, I've been working with the Western Passport Center in order to determine what we would need in place to be able to start offering passport services again. Due to the volume of people that come into our small space that we have in our lobby, the best path to opening it up would be to accept passport applications by appointment. This way we can control the number of people that are in the space at one time and adhere to the social distancing requirements and keep our employees safe. So the Western Passport Center has given us approval to open up under those conditions when the time comes. So our phased approach is to, like Derek and Don, identify and develop appointment scheduling software, and we've been working with IT to do that. explore and install permanent sneeze guard shield or security glass for the passport services windows. And actually, they just dropped those off yesterday, those temporary. And take the lobby area, and we've taken out all the chairs there and just put enough distance. We put like 4 sets of different chairs there. So our lobby is configured to what needs to be. And then in phase 2, we would roll out a communication plan and social media advertising regarding how the services would reopen. And then we would reopen the passport application services for a limited number of daily appointments in order to enforce the strict distancing guidelines. And then in phase 3, open passport application acceptance services full-time by appointment. So then we could be offering it all day and do that. But in talking about when we would be ready to reopen the program, it's important to keep in mind that the Western Passport Center is currently closed. So no passports are getting processed unless a citizen can prove that the need for the passport is a life-threatening situation. So anything that, if we were open and sending them, they wouldn't be getting processed. So we would not reopen before the federal government opens up their passport services or their facilities. But having said that, we're really not tied to opening exactly when they open. So if we don't have our everything in place and they open, we need to have our appointment software ready, and we need to have our health issues resolved before we open. So they understand. So if they were to open tomorrow, but we didn't have ours, we can wait until we have ours to open up. That's not what I'm trying to say.
Vice Mayor.
So Dana, are we, we're gonna wait until we're completely out of it to do walk-ins, or is walk-ins no longer gonna be an option?
I think at that time we'd want to really look at it. My idea was kind of do a hybrid. Is once we have appointments in place, we continue to do appointments. It helps us manage that workload better, because if you've ever been down there and you've seen people have had to come in and wait, an hour, 2 hours at a time, and it's just not good customer service. So we get a lot of calls every day say, well, can I get an appointment? So that's the way I'd like to move forward in the future. We talked about, maybe walk-in Wednesdays or something like that. To still offer. And of course, if someone walked in while we were doing appointments and we had time, we would continue to do, we would do their appointment, their passport. So.
I like that. Taco Tuesday, walk-in Wednesday.
Wednesdays, yeah.
Councilmember Wong.
This is very quick question. Do we offer a mailing service?
For passports?
We only do in person. We do not.
For renewals of passports, you can do mail-in. They only accept mail-in. But for your first time, or for children, they have to get renewed every 5 years. They have to come in person, and that's in any facility in any type. So brand new passports, and then children, when they renew, it has to be in person.
I just want to confirm. So you said renewing only accepted by mailing.
Yeah. So if you have a passport already and you need to renew it, you can do that by mail.
And can I also do it in person too?
No, renewals you cannot do in person.
Okay,
So.
got it. Thank you.
All right, Leah.
Right, thank you very much, Mayor and Council. I want to start by talking about code enforcement. We have had somewhat of a moratorium on code enforcement. We found early on that as soon as we were giving notices to residents and businesses, we were being met with, I have problems paying for the landscaping right now, I'm out of a job, I'm not able to find contractors, especially from the businesses, we were hearing that. And we really did not want to add to the stress that everyone is going through right now. So what we have done is currently we're doing code enforcement on extreme health and safety issues. We've also spent this time to go through existing cases that were already open and do re-inspects on those and try to close as many of those as possible, so that when we gear back up doing enforcement, we are in a better place with cases closed. We are continuing to take complaints on a daily basis. I will tell you that the Chandler residents have been very gracious. As soon as we explain the situation, we have not had anybody upset with us at all. They all understand the situation. So we've been documenting those cases. And what we would look at doing is, as we ramp up into phase 1, we will take those cases that came in, We'll go out and do inspections, and rather going into notices, we would do an informational letter, again, to give people an opportunity to see if the situation can be corrected before we start going into the formal notice process. Those letters would be mailed. In phase 2, we will go back to regular inspections and notifications. However, we will do that through mail rather than the door hangers. That was something else that, as we've monitored social media and heard comments, people are nervous about door hangers being on their door because there's not knowing how long a virus possibly could live on paper, things like that. So we would go to the notices by mail. And then for businesses, we're not going to go back to full code enforcement with businesses until phase 3, because we know that they are going to have additional financial challenges as they ramp up. Just like the fire chief said, they don't like to see fire inspectors. Businesses don't necessarily want to see code inspectors in as well when they're trying to figure all of this out. Of course, the sign code is something different. Council did put some regulations in place. And so, of course, as far as going enforcement with the sign code, we will be looking to council's guidance when you take action on that issue in the future. Diversity Office had a major event planned at the end of the month, the Veterans event. I think all of you have participated in a video for that, so you know that event is going virtual with a video presentation, and we are still working with the museum to hopefully be able to show pieces of the exhibit that would be there virtually. Forest City is getting ready to kick off Operation Back to School. We certainly will not be doing that as an in-person kickoff, and we will also be looking at Operation Back to School to see how we might be able to look at distribution in a different way to make it safer for everyone. So that's a process that we expect all of our partners to go through and help develop a new system for that. And then for the Forest City Breakfast, we have postponed that till the fall. But we will start with Forest City Day Committee, looking at areas and everything, again, keeping the social distancing and meeting requirements in place. Homeless navigation continues today. It just looks a little different because it's all 100% out on the street rather than people coming into the intake room. It's been working fine. Our homeless population knows how to alert us that they're there at the building, and we send the navigator out. So we'll continue to do that. As Ryan told you earlier today, we're making sure the navigator is going out to encampments and having regular communication. We are not doing any transportation at this time. Phase 3, we will look at beginning transportation again. We are also looking at what we might be able to do for safety purposes with a vehicle that we use for transportation. And this is in line with what's happening with Community Bridges, who is another one that transports a number of the homeless who contract navigation services. They're not doing transportation right now as well. And then public housing. So this has provided an opportunity for public housing to move forward with putting some additional processes online. Right now, what we're doing is we are having our residents, they can call in or email in for an appointment. The housing manager, the housing specialist will call them. If they can't take care of what their issue is in just a few minutes, then they'll go ahead and make a formal appointment with them. They're conducting all of that over the phone. They continue to come into the office at least once a week for file management. And so we would continue to do that. We've been using management services, utility billing Dropbox, but we are going to have a larger Dropbox installed. I think that's something that's just a benefit to our residents as we move forward anyway. It allows them to be able to drop off that paperwork. We had walk-in Wednesdays with our lobby. That's been challenging. We have a lot of people that come in there, so we will look to transition that to appointments and really kind of monitor that as we move forward. The other pieces are housing youth recreation program. It was an after-school recreation program, and then when school wasn't happening anymore, we switched to a meal delivery program, so that staff is picking up the meals that Chandler High and Hamilton High School are handing out to students, and we're delivering it to our housing youth at their locations. They will start working on their summer program. Summer program will look a little bit different. We're going to reduce the number of our housing youth that are in the program, and so we'll be finalizing those plans in phase 2, or phase 1. We'll open that program in phase 2. We'll go back to some limited appointments in phase 2. We'll start scheduling our fair housing training. We're hoping to move to the online appointment scheduler to make things easier, certainly put in the social distancing. We can put some markers, 6-foot markers in our lobby. We are fortunate that we have glass in our lobby, so we don't need to worry about the sneeze guards and things like that. And again, with that housing youth program, we're going to look at that limited attendance. Playgrounds and basketball courts. I'm not sure if everybody even realizes that we do have the playgrounds and basketball courts at our sites as well, at our 4 sites. So we will open in conjunction with parks. When Andy opens up his playgrounds and basketball courts, we will do the same at our sites. And finally, on phase 3, then we will go back and open our lobbies and the intake room. Our housing rehab program has also been on hiatus because 2 reasons. Our nonprofit partner isn't doing the program right now, but also part of that is because they need to go into people's homes to do inspections and because they're not able to get contractors to do work. So we really are dependent on when all of that system can come back up together. So we have regular meetings with our partner in that. And so we'll work on that as we're all able to gear up. We'll resume with our tenants meetings and community meetings. We're handling maintenance work orders right now. Emergency orders are always in place 24/7. We have contractors that that go out and do the work orders for us. I am requiring that my staff or contractors wear gloves and masks if they're going into anybody's unit, especially our senior units. We want at least to have some level of comfort that we're practicing everything we possibly can to keep our seniors safe. So that is a requirement that we're doing. And as we gear up and continue to go back into units more, we certainly will be taking into account those safety procedures. And the other reason that we have to go into units is for inspection. HUD has loosened up on having to do biannual inspections right now of units that are occupied, but we still do inspections for units that people are moving into, and we do, so it's vacant units, and we do have a contractor that is doing those vacant unit inspections at this time.
I have one quick, are we doing anything, so there's an older group over at Kingston Apartments. Have we, what are we doing over there? Just like to make sure that's an older community. What are we doing to help make sure that they're safe? Have we talked with them?
Yes, Councilmember Stewart, through the mayor, Councilmember Stewart, we actually, not just Kingston, but any of our senior residents and any of our housing sites and our Section 8 sites, we have been making phone calls to them to check on them. We're also making sure there's food boxes going out. We actually were able to get some toilet paper in the very beginning of things. And so we used for our city funding to get toilet paper. And so we're making sure that if our seniors are running out of things like that, that we're supplying them with that. And we've coupled it with the census. So we actually have census part-time staff that is making the phone calls to check on them and make sure that they filled out their census. We're doing the same thing with About Care and Neighbors Who Care with their population. And then if one of the clients from About Care or Neighbors Who Care said they need something, then we're referring that back to those agencies.
Great, thank you.
You're welcome.
So Leah was the toilet paper hoarder we've heard about at Costco.
One of my staff is very ingenious and found a bunch on Amazon, so.
All right, thank you.
All right, Kim.
All right, because our facilities are closed, we're talking about a reopening plan. So part of our phase 1 for our museum and vision gallery is developing the marketing strategy for the facility opening date. That means programming goals for the next 30 to 60 days. We'll be identifying the PPE needed for staff for installing the in and out of our exhibits, developing social distancing guidelines for those public areas and timed entries to limit the amount of people in each facility if we need to. And we'll also be developing museum procedures for rentals to make sure that we can have a social distancing protocol during those times as well. During phase 2, we actually recommend opening up the museum and vision gallery to the public, but we will be staying with the existing exhibits. It takes too many people, too many hands putting the exhibits up and down to move them at this time. But we would suggest continuing the programming and special events to be virtual as we've been doing. We'll also be providing scheduling of all of our events, programs, shows, and classes online at that time. And then our phase 3 will be resuming all normal operating practices. For the Center of the Arts, phase 1 looks very similar to the museum and vision gallery by developing a marketing strategy for opening up the facility, programming goals for the next 30 to 60 days, and identifying the PPE needed to load in and load out of any of the programs and shows. Phase 2 will be providing scheduling of all of those events, programming, shows online, establishing venue-specific cleaning and safety protocols, especially for those high-touch areas like the bathrooms, the dressing rooms, behind the stage, etc. We'll also be reaching out to the vendors to confirm event-specific needs if they can be fulfilled or substituted depending on demand. We'll also be identifying alternative locations for areas where we conjugate a lot, like the dressing rooms, and looking for potential additional spaces for programming, maybe even outdoor performances. At this time, we could resume small events using CDC guidelines. Our summer programming for the kids' camps are coming up, so we've already been identifying ways that we can take the larger group and break them down into groups of 8 with one teacher so that we can have them separated as we needed to. And as the parents came in to watch the performance, it's a smaller group of parents. And then we'll also be training staff and volunteers on how to answer questions and concerns related to COVID-19. During phase 3, we'll be installing all of the protective barriers to the areas of transaction. This would be the areas for the box office and the concession stands, increasing the standalone hand sanitizer stations, encouraging patrons to bring credit cards instead of cash, monitoring and maintaining the level of disinfectant sprays and wipes needed again, for those high-touch areas. Right now, our box office is closed. We would recommend opening that during phase 3, and we'll be implementing the use of gloves. And at this time, the CCA will initiate events using CDC recommendations and social distancing protocol. When we look at our main stage that can hold approximately 1,500 people, we can still have 6 feet differences and still put in somewhere between 300 and 400 people. So we'll be looking for performers with that specific niche. Our special events are already closed until the end of May. It just so happens that that goes into the heat of our season, which slows down all of our events. We do anticipate the farmers market starting back up in June, and we do have our 4th of July spectacular in July, but those are the only events that we know of now. During phase 1, we'll begin reaching out to the producers to let them know when they can begin resuming events on city-owned properties. We'll also be identifying any extra precautions for special events that they need to consider until the end of the year using those CDC guidelines. This will include social distancing, use of disinfectant, additional cleaning stations, etc. In phase 2, we'll be communicating that to all of the event producers. And then in phase 3, we'll resume normal operations, again using CDC recommendations. And with that, I'm happy to answer any questions.
I do have one question, comment, and I had talked with city manager earlier. I don't see any reason why, particularly the scheduling, I realize there's some porousness between 1 and 2 in these, but some of these with longer windows, it seems to make sense that long-range scheduling could be going on now, plus phase 1, rather than, specifically designating that to phase 2.
Mayor, we will be doing that as much as we can, especially for the Center for the Arts. It's really, it's going to be a challenging time to reschedule because many of these things have tour dates that go along with it. So even if Arizona is in a good place, if they're not touring because they can't go to other states, they may not be able to come here too. So we'll be looking long-term at some of those, but we may be limited in the short term to picking acts within 30 to 60 days. But of course, we'll continue to look long-term.
So hence the reason to try to fit that in now rather than waiting. We might not schedule, but certainly don't want to miss opportunities for the same.
Absolutely.
Councilmember Wong.
Do you have the number, how much revenue we lose for this past months?
I do. For the Center for the Arts, we've lost about $400,000 right now.
400,000. Okay. And I just feel like it's that fiscally feasible to organize some kind of performance if we are going to follow those CDC guidelines, because we may only have 100 people, 100 audience, and then it made no sense for the performance group to come here to perform. So that I understand that probably a very good very big challenge too.
Through the mayor, Councilmember Wong, that's exactly what will be some of the challenges that we have. With groups of 100 to 400 people, we'll be looking for performances that we can still break even or make money. So it will definitely change what the event schedule will look like in the next fiscal year.
Councilmember Stewart.
Thank you, Mayor. I wanted to rewind on the farmers markets. I know it's getting late, but do we vote on that specific date and say, okay, this is when we're going to do it? And did we discuss, did this come up about reevaluating whether or not we could open that up? That seems like a very safe place for people to get fruits and vegetables and beef jerky.
So,
Mayor,
Councilmembers, I know one of the things is that was, I believe that was one of the, as we mentioned last time, covered under the governor's statement of farmers markets. So it kind of follows his lead on that, is my understanding.
Okay.
Am I correct on that?
Mayor, Councilmember Stewart, we actually could do the farmers markets. The
Okay.
DCCP is choosing to make the start date on June 1st. It's the DCCP's desire. They could start earlier if they wanted to, but they're choosing the date of June 1st.
Okay.
Okay. Councilmember Wong.
So I don't recall we have discussion in these slides about when to open farmers market, right? Did we?
We did have a conversation
Yeah.
at the last time when we were discussing closures and openings. Yeah.
But we didn't give the staff any instruction. We didn't have a conclusion on that.
Correct.
Okay. Now, cultural director told us it's planning to open around June or June 1st.
That's what she just said.
Yeah. So are we going to have a meeting to make that decision, or we just trust the director to make that decision on her own?
So tell us the difference between, it's a DCCP event, I believe, right?
Mm-hmm.
So it's the downtown markets. And was I incorrect in stating that this is not covered under the governor's things, or is there some types that are and some that aren't?
Right. Vice Mayor, Councilmember Wong, it was considered an essential service. Specifically, the type of farmers market that the DCCP does has some vouchers that go along with it that makes it even more important to get those farmers markets going. The direction that we got when I was here last month was if the situation continued to improve, that the council would be open to the farmers market starting earlier if they wanted to. The farmers market the DCCP has chosen to begin June 1st because that begins their summer season. Limited hours, smaller hours, so that's their choice. But it is a DCCP function.
Councilmember Wong.
I feel like to ask this question because it's on our property.
Sure.
One just real quick, condensing hours actually forces more people to be there at one time. So just something you might want to bring up with that leadership group or whatever.
We're counting on that good old 115-degree June heat. City Manager.
Mayor, Kim already re-outlined what the council direction was at your last work session in regards to that. If there is different direction than what Kim is offering tonight, we need to know that now so we can start planning.
I'm seeing heads saying we're fine with that direction. All right. I'm seeing deer in the headlights with Councilmember Stewart.
Direction for the
For them
markets?
to open in June.
Well, that's up to DCCP.
But it's on city property. That's the point.
If they want to go earlier, then we'll talk about it.
Okay. Proceed. Thank you. The end is in sight.
I'm the last one. I'll try to make this quick.
The best for last.
We saved the longest for last.
So there are 4 tracks that community services is following as we look to reopen our facilities. The first one is our park amenities, and honestly, we took kind of the first step tonight where we talked about those amenities that we could open that would allow for physical distancing. That was not included in the governor's order. Phase 2 would be reopening all of the other amenities that were closed by the governor's order. And we would be looking at doing a limited opening of park restrooms. And I would put a caret on that one, that one will be time sensitive because that is done by a contractor and they may need to rehire their staff. So there may be some delay. It wouldn't be like tonight where we could open up the next day. There could be some time needed to ramp up for those cleanings. And then phase 3, we would return back to normal service. And the big addition would be we would start doing reservations for park amenities, shelters, and our athletic fields would occur in phase 3. We would also propose that we would keep 3 restrooms closed for the time being, and that is due to some heavy vandalism that we've been experiencing at those parks. So we would look to keep those closed for the time being. The next track is in our recreation center and programs.
Annie, can I ask you to go back on that for one? So if on phase 3, we are returning to reservations at any of those parks, so if we've got a bunch of Little League or girls softball going on at Foley Park or Little League at one of these others, what would the bathrooms do if indeed we've got the park full of kids?
So we would work with those leagues specifically to provide access to those restrooms or make a different accommodations. Like we had with the girls softball, we brought out porta potties to meet those needs, but we'll work with those leagues to make sure their needs are met.
Okay, thank you.
Mayor.
Councilmember Wong, then Councilmember Stewart.
So on the phase 3, you are saying all restroom open except those Apache, Foley, and Navarrete parks. And your reason was because it was vandalized and it need to be fixed. So why don't we fix it now? So when we are at the phase 3, we can open it.
Yeah, so we have been working on making those repairs, and we can make them ready. It was just to deter future vandalism. It's been a reoccurring theme at those restrooms that it's pretty much a constant weekly, if not daily occurrence in those parks.
Get it correctly, you are saying if you fix it, repair it right now, maybe at the time we want to open it, it will have another damage again.
Correct.
So you were ready to wait for it at that time. Is that what you mean?
Yes, sir.
Okay, thank you.
Councilmember Stewart.
So I am trying to look at the executive order for the parks from Governor Ducey. Can you dive into fields and why that's in the phase that it's in? Is that based on the governor's direction, or?
So the governor's
It
direction.
seems like being outside would.
Yeah, so the governor's direction was not specific to athletic fields. So that is not included specifically in there. But it does talk about social distancing. And I think that's the conflict that we're having is, particularly when you're playing youth sports, how do you keep 6 feet of social distancing while there are games occurring, spectators, things like that. That could be a very difficult thing to happen.
I mean, that lacks consistency with our discussion about some other things. Just simply does. So either people can stay 6 feet apart or they can't. I mean, we cannot govern that, but it just seems to me that we have outdoor sports, we have skate parks, we have all kinds of things that we're talking about, and you moved it into phase 2. We can go back to school, but we can't go play a softball game. I'm just saying, we might want to wrestle with this. It's late. I'd like to see you come back with a little bit, or I'd like to propose that we move this up in the phase a little bit. Yeah.
City Manager, did you have a comment?
I do not, Mayor.
Okay.
If that is something that the council wants to pursue, again, this was drafted around the president's guidelines and the social distancing guidelines.
So, Mayor.
Councilmember Orlando.
I think it's getting late, but how are you going to keep 12, 14 people in the dugout 6 feet away? I mean, you gotta be a little bit more flexible here. You're gonna have spectators in the bleachers, particularly on baseball, softball, those type of, and even a soccer team. You know, you're gonna line them up in a row. So, I mean, I heard a lot tonight about opening stuff up, and I get that, but let's be a little more practical on some of these other facilities. In fact, these own entities understand that they can't maintain those guidelines, and they've canceled their seasons this year. So, you know, I'm just suggesting that we, you know, let's not give anybody false hope that we may be opening this up sooner rather than later. I'd rather us just wait on this particular guideline.
Hope is never false, but to the point that you're making, there are professional sports that are looking at starting up. There are
No fans.
and with no fans. So there are options that we can look at. We cannot govern people to what they can and cannot do. If they've been given a recommendation to social distance, we cannot govern that. But if we think that we're liable because we do offer sports, that's a whole nother conversation. Are you suggesting that the city's liable by providing sports fields to our citizens?
No, council member, I'm suggesting that we have a maximum amount of hospital supplies, PPE supplies, and to give individuals, those, you're right, maybe 50%, 80% of the people will respect that, but what about the 20% of the people that may not? And then now we're stuck with emergencies in our hospital. So, I mean, let's be, I guess I'm a little more guidance here, a little more cautious in those type of activities. Yeah, again, disc soccer and skate park, we talked about that ad nauseum, but again, I really believe that these softball, baseball, these close and fine facilities is going to be a hard one to swallow, at least in my mind.
I hear you loud and clear, and I am actually grateful for the cautiousness. I think it's a good like tug of war here. I just see all I'm going to point out is there's inconsistency with what we've outlined for our school districts as it relates to going back to school and what we have for our own decision that was made without a lot of discussion about shutting down our ball fields. And now they're in a phase 2, which is later than schools, or it's in line with schools, right? Right, potentially. My point is that based on data, kids are not getting this, and they're certainly not, unfortunately passing away. And so I think using data that we've got here, that we need to make common sense solutions. And maybe that isn't in May, and maybe it's not in June, but we don't know where these numbers are going to end up. Anyway, I'll leave it at that.
Mayor.
I'd suggest that why don't we revisit this one, because again, we're not even in phase 1 right now, much less phase 2. So maybe put an asterisk on the opening of things that I'm hearing both sides, but I think we certainly all agree that if everything else is being directed by social distancing, you can't have little soccer players playing amoeba soccer, because that's what they all do around a field, or you can't have a baseball or women's softball dugout full of athletes or parents watching on a bleacher and social distancing. But I think this is probably worth us revisiting at a future time. City Manager.
Mayor, I was just going to suggest that this is definitely one that we probably want to wait and see what governor's direction is in regards to this, and certainly we can make those changes and bring back some recommendations.
Yeah. And again, the caveat with all this presentation is that we don't know what our governor is we're a bit of ahead of his public presentation of a rollout right now, and he might have 2 phases or 5 phases, in there that we will then correspond and follow. This is just based upon the governor or the president's recommendations to the states, which Governor Ducey has indicated that he gives credence to. So there's still a lot of play that will happen with here. All right, continue, sir.
Thank you. So looking at our recreation center and programs, phase 1, we would open up the tennis center, just the gate as we discussed earlier this evening. We'd look at Tumbleweed Recreation Center, and of course that's going to be tied to the governor's orders. We'd look at the fitness areas, gym, track, some very limited programming that we can do with social distancing, such as personal training that could be done one-on-one or very small group fitness programs. We would begin being prepared to sign up for our summer recreation programs. And we want to make it very clear that our goal will be to serve Chandler residents first. And so we will make sure that those spaces, those limited spaces, are filled by Chandler residents before it's opened up to those who live outside of Chandler. Phase 2, more facilities come online. Again, these would be limited hours, programming. Tennis center, we would begin to open up the clubhouse and do some more ball machine rentals and look at programming there. Tumbleweed, again, increase programming where possible, and again, increase hours of operations. And we begin doing our summer recreation programs that we can work with social distancing and in smaller groups. Phase 3, again, all facilities are open, normal hours, and we're working to get back to normal programming. At this point, we would bring back the senior center, but again, it would be in limited hours and programming, just to make sure that they are safe while they're in our facilities.
So my one comment back to phase 1, since we're not saying we're in phase 1, then to remove the top bullet there, tennis center gate drop-in play, if we're doing that before phase 1, I wouldn't want to confuse people, then somehow think, oh, we're in phase 1 because that's there.
Absolutely, we will remove that.
Any other comments, questions?
Mayor. Oh,
I'm sorry.
Sorry.
Let's talk about pools and aquatic centers. Our phase 1 is we would be opening only 3 facilities, Nozomi, Desert Oasis, and Mesquite Groves, and it would only be for lap swimming with very heavy restrictions on number of people that can enter the facility and number of people that could be in each lane. We'd be looking at doing some aqua fit classes and really focus on hiring lifeguards and getting ready for our phase 2, which would include swimming lessons, diving lessons with small groups, potentially allowing club swim teams the opportunity to come and practice, and doing some very limited public swimming, and also adding Arrowhead to the 3 pools that were already in operation. And then phase 3, it would be all pools open, normal hours with our normal programming as best we can. Questions on pools? Okay, final one is the library. Phase 1, we would open all the branches, but it'd only be the lobbies of those branches, and we would work on just doing circulation of materials. So this would be kind of, you would go and call in your order, and then you would come and pick up that order inside these the lobbies of the libraries. We'd quarantine each piece of material for 72 hours when it's returned before it's allowed to go back out in circulation. And staff would be there to assist with holds and other customer service. Phase 2, again, all the branches are open. We would work on trying to reopen more portions of the libraries, looking to do computer access. Again, there would be distancing completed that. We would keep our computer labs that are separate rooms. We'd continue to keep those closed and just use the more public-facing computers. And then phase 3, we're looking, again, back at regular services, start up our programming, and back to our new normal. And that is it.
Mayor. Andy, just something like for reference, and I think this for all the departments, is we condense hours, it concentrates attendance into packed times. We really need to maybe look at keeping the hours lengthened. The story about the subways that were condensing their hours of time, it just meant more people were trying to get on. The same thing will happen with our computers, and just something to consider. Thank you.
Mayor.
Councilmember Orlando.
Good point there, Councilmember. Very good point. I agree 100%.
And I would just add that when we're looking at facilities, we're going to need a couple weeks to get ready to reopen, just so we can get staff scheduled and make sure we have enough staff. And that's kind of where we're looking at with limited hours, was not being sure we had enough staff to cover full operations right from the get-go.
So Mayor,
Councilmember.
Question for City Manager. We saw a lot of gloves, masks plexiglass protection. What's the rollout on that?
Yes, so Mayor, Councilmember Orlando, that's an excellent question. My Collingsworth is sitting in the back there, probably sweating bullets at this point. But nonetheless, it is going to be, all of this, again, will be based on the fact that we have this available. They are already working hard to get these things formulated and installed right now. So once we get into these phases, hopefully we'll be ready. But to your question about gloves and PPE and those sorts of things, again, as I mentioned earlier, it's going to be a supply chain issue. And those may be questions that have to come back to mayor and council if we have to come down to, okay, we can only open so many because we don't have enough supplies. So those questions would have to come back if we're not able to obtain much of those PP&E things we have on all of these lists.
Follow up, Mayor, please.
Please.
So is it a good policy to take a look at this plexiglass barriers, that type of stuff for long-term as well, just not, I mean, short-term? I look at the city clerk's area, I look at a lot of the areas. Is it probably more of a good idea just to put these in place at a permanent structure?
Yes. So Mayor, Councilmember Orlando, you are correct. Anywhere that we can get this up, I'll talk about it now, even though it's going to be part of your budget discussion tomorrow. We recently did a safety audit around the city in terms of a lot of our counters and things like that, where employees have been kind of nervous, and we've had a few incidents in regards to that. So this is an opportunity to take care of both along these lines. To your point, anywhere we can get something up more permanent, we'll be looking at that. But again, it'll be timing and how fast we can get those things up. But you're correct.
Thank you, Mayor.
And City Manager, it's also my understanding that all the additional equipment, PPEs, plexiglass, are candidates for CARES Act expenditures for cities. We don't know the timing, we don't know the pipeline, but those are the kind of things that are extra expenses that we're encouraged to track and submit, correct?
Mayor, all of these things are going through our Emergency Operations Center, and we are tracking every cost
Great.
for future reimbursements.
Councilmember McClymons.
Quick note, the plexiglass, just one, CK Valente, local company, they're making those. Just keep that in mind when you're looking at them.
Yeah. So I do want to say, well, others first, I'm not close. Councilmember Wong? Okay. I do want to say thank you, City Manager, to our teams that are here. It's clear that you guys have spent a lot of time and probably have harangued back and forth about best policies and putting this together. We appreciate that, and I think while there's still some unknowns in regard to what our governor will do and making this Chandler right, I think this is a great set of guidance that will serve us well as we go forward. So I want to thank you all for all the work that has gone into this presentation tonight.
Thank you, Mayor. Speaking on behalf of the team, we really do appreciate that, and you're correct. It has been a lot of work. As you can tell from the presentation tonight, it's a lot harder to start up than it is to shut down. And so that's why we've been planning for a while already on this. So thank you, and thanks for your time this evening.
Council, any last comments? Councilmember Wong.
So I just want to say thank you. This is really uncertain time, and although you make all those recommendations, maybe a week later we need to redo everything again. I don't know. Hopefully we don't need to. So just like to say thank you. And it's getting late, so have a sweet dream. Okay.
So, Council, what time's breakfast? 6:30 tomorrow? Yeah. I suspect tomorrow will be a meaty day as well. So City Manager, again, is it 8 o'clock opening for food provided, or 8:15, and then we start at 8:30? What's the schedule start?
Mayor, so 7:45, breakfast individually wrapped will be provided back here, and the actual meeting kicks off at 8:15.
All right. 8.
Thank you.